Let's see. With the deepest gratitude, we to our founder, Dr. Hegde, to bless us this conference. You welcome, sir. Come on. Yes. Sir, video introduction. Hello, we are going to play the video, introduction video.
Just a second.
This is Dr. Shweta Singh, KHA Administrator. Would like to take privilege to introduce our Homeopathy study group pro bono. It was organized and founded by Homeopath and humanitarian Kavitha Kukunoor, President and CEO of Kavitha Holistic Approach, on May 5th, 2020. This study group is intended to be an offering from Kavitha to the homeopaths around the globe, sharing goodwill and solid clinical work within the classical model and foundational principles for the CAR. Kavitha is HNI accredited, CPD provider and outreach coordinator of CNCPR committee. She is a great leader and mentor, international speaker to name few, joined American Homeopathy Conference JANC Mission 5000, LMHM, committed and passionate for homeopathy. She supports the charity organization of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. God's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes, using holistic approaches via webinars which are based on principles of classical homeopathy and provide professional continuing educational homeopathy credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. The study group generally offers free monthly webinars once or twice a month. Spending the last 2 years, more than 100 educational webinars with over 250 recordings, some HNI approved, were hosted by Kavitha Holistic Approach. By virtue of Kavitha's charisma and commitment to service in the field of homeopathy, she gathers and brings together dynamic, like-minded teachers, honorable guest presenters, and inspires young homeopaths around the globe. The study group celebrated stage 4 cancer survivors by providing moral support, offering them space to share their dramatic and encouraging stories through a series titled Inspirational Book Talks. Each webinar is recorded so members may view the presentation at their own convenience at YouTube channel Kavitha Kukunoor if they are unable to attend the live session. Homeopathy study group offers free recordings to homeopaths. This is an exciting study group rich in substance and soul. Newsletters showcasing upcoming events, previous recordings, and articles reach more than 2,000 homeopaths worldwide. Kavitha's pro bono experience with the study group and her outreach with other organizations has also been a most awesome personal reward. She leads a team of 15 to 25 people in such a way as to foster harmony and group unity. Dr. Kavitha is the recipient of Martholman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Lingaraju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. Lastly, Kavitha shares her true life experiences in her book titled Beyond the Limits, A Challenge to Prove Oneself, which she published in 2011. Through her journey, Kavitha hopes to inspire younger generations and to encourage anyone on their path to their highest purpose. In her book, Kavitha shares the obstacles she faced to raise her family and not let go of her personal and deep passion for homeopathy after being uprooted from India to the United States of America. We happily celebrated her second writer, ebook, A Dose of Spirituality with Kavitha. Dr. Kavitha donated the proceedings of both books through CAR study group platform to various charitable organizations and homeopathic associations. To learn more about study group, visit www.kavithakhomeopathy.com. Thank you.
Thank you all for coming. And I know it is not easy to come this far, especially the Pyramid Valley International, which is at the outskirts, I would say, and it is 1.5 hours to 2 hours. And today's, I would welcome all our speakers, honorable speakers, onto the stage, and some are online. And our chief guest, Dr. Shreepad Hegde, will be speaking on qualitative research on anemia in patients with diabetes mellitus. And Dr. Shweta Singh, our Chief Administrator, will be speaking on evidence-based homeopathy in gynecological disorders. And Dr. Deepa Rajenimbalkar, legal issues in homeopathy by Dr. Rajneesh Kumar Sharma. And children's healthcare needs and homeopathy by Dr. Deepa Rajenimbalkar. And Dr. Mamata will be speaking on clinical spectrum and role of constitution in treatment of PCOS. And we have Dr. Deepika Balani speaking about the beyond medicine, the homeopathic approach to cancer pain. So all these scientific sessions, there's so much information to gain. Please enjoy the sessions, and if you have any questions, we will take at the end. Thank you. Hello everyone, I am Dr. Kumar, volunteer. I am inviting the CEO and President of founder and director of Homeopathy Group, study group, and renowned international homeopath and good mentor leader, Dr. Kavitha ma'am, to on a stage. Thank you, Dr. Mamata. Now we are going to start our scientific sessions. So Dr. Kavitha Kukunoor, she is the first our speaker, and I am honored to invite her. She is the nationally board certified classical homeopath CCH USA. She is a registered member of NASH USA, certified HP supervisor in homeoprophylaxis, served at FHCI board in 2019, served HP WWC board in 2019, past HWC president and CEO, and lifetime member of NCH, and associate editor of Homeopathic Heritage, and LMHI member, Liga Medicorum Homeopathica Internationalis. So, Dr. Kavitha, please come and have your stage. Thank you. Thank you, Dr. Mamata. My topic for today is homeopathy and meditation, a spiritual science. I know many of you know about meditation, but what I see is through meditation also there is homeopathy. And Dr. Mamata has already introduced me. So many of you know about the connection, and so today I'm going to share my knowledge, my experiences which I gained over the period of years, and again I quote Mother Teresa's. We ourselves feel that what we are doing is just a drop in the ocean, but the ocean would be less without that missing drop, with that drop. And homeopathy is a scientific and holistic method of healing.
And it's a dynamic system of medicine addressing the root cause, the basic cause of sickness. And homeopathy founded by Dr. Samuel Hahnemann in late 18th century, and it works on principle like use like.
So that we can cover all.
And get to one. Dr. Kumar. And homeopathy treats the whole person. And when we see the meditation, it is still the same. And when what meditation does, it silences our restless mind. And there is a scientific thing, the quantum physics, which I am going to share in other screens. And it preserves our source energy, gives good health, great peace, and wisdom. So both meditation and homeopathy are spiritual, scientific processes, and both of them develop the neuroplasticity. So what happens when we meditate is, see, mind becomes empty, and that is what we are supposed to do. When we empty our thoughts, then that gives the energy. And we can, the third eye chakra, pro chakra, can be stimulated, activated, and we gain the cosmic consciousness. And I have started this miraculous mind. And right now, see, I came here for advanced retreat with the CEO Quantum Foundations, that the meditation. So that's how I thought to have the connection. And it is called as the Brahmashi Pitamaha Patriji is the founder for the pyramid meditation. And meditation is practiced in all religions and in every scriptures. So I'll be providing a couple of sessions to people who are interested. It is called as Anapanasati meditation. Maybe if we have time at the end, we can just have. And pyramid meditation is done inside a pyramid, under a pyramid, that is called pyramid meditation, and it is 3 times more powerful than the regular one. And the Patriji says, science behind pyramid meditation, that all the specks of energy, we are all made up of energy. The consciousness and the knowledge, the whole nature, we are all together. And infinite, the full infinite number of beings. Every event is considered in a dynamic state. And most people have experience with pyramid meditation, describe themselves as total alignment. So spiritual sciences sees health as a reflection of harmony. See, we know like homeopathic medicines act at dynamic level, right? And the remedies are prepared beyond the Avogadro's number. So the consideration of disease and the treating of the disease also at a spiritual level. And thus, we live to the conscious, to the fullest and blissful higher purpose of our existence. The science behind the homeopathy and breath mindfulness meditation is the quantum physics. And so everything is energy, and wherever your attention goes, there the energy flows. And as R.D. Shankaracharya says, that non-duality means we are all single dynamic energy field. And both homeopathy and meditation, they all lead to the holistic healing and emphasizes on the self-healing and personal responsibility and taking care of our both are neurosciences. And Dr. Hahnemann said to be an observer, and even in the meditation, you just conscious observer. So when we are a conscious observer, focus on our breath. That is what is the energy, because we empty all our thoughts. And homeopathy and meditation deals with heart and brain. So basically, I would really thank Dr. Rajneesh Kumar Sharma. He has done such a beautiful work, created on neocortex and its functions in context of principles of homeopathy. And there is another book which is From Heartbeats to Brain Waves, an in-depth analysis of electrocardiograms and cephalograms and homeopathy. He clearly mentioned how homeopathy at a quantum physics, at a dynamic level, affect the heart and the brain waves. And the books are here. There are so many books of Dr. Rajneesh Kumar Sharma. Anyone who has come here, please check the count. And as per quantum physics, human being is made up of organs, cells, molecules, atoms, which has electrons, protons, and neutrons. So all this is all, when we see, we are all made up of this. And it comes to 99.9999% is empty. And it is all filled with energy. When we see the electrons and the protons and neutrons inside it is. And only very minute is the matter. So that shows that we are less matter and more energy. At subatomic particle level, everything is both a wave and particle, leading to many possibilities, infinite possibilities. You become what you believe. So during meditation, when we put the positive affirmations and manifestations, and it will come true. And that's what has happened for me to do this session here at Pyramid Valley. And according to the quantum physics, the research shows that everything we call real is made up of things that cannot be regarded as real, and that is from Neil Bohr quantum physics. So when quantum physics experiment, as per that, the scientists released electrons which they could not see where they are going. And when they started to become conscious observer, then they could see the electrons. Wherever they see, they could find the electrons. So just like see, when we believe in God, if He exists, you see God everywhere, wherever you want, feel like. So that is what has happened. And synergy between homeopathy and meditation both focus on holistic healing of the individual and not just the symptoms. And both aim to the balance and harmony at a deeper spiritual level and complementary, and they can address the physical and energetic imbalances and also provide the mental clarity and emotional stability. So sphere of action, when we see like we consider the individual both all the levels, physical, mental, emotional, spiritual level, and give the remedy. And the same through meditation. See, Raja Yoga, where you become the king of yourself, it is also part of the meditation where you attain that homeostasis, coherence, and when we get all this, it is like appreciation, compassion, showing gratitude, empathy, and all this will lead to the higher purpose of our existence. And the principles and homeopathic guide in the book Organon of Medicine. When we see the first thing, the physician's highest and only mission is to restore the sick to health, to cure, as it is termed. So this can be achieved in many ways. And the highest title of cure, aphorism 2, and aphorism 3, application of the knowledge of the disease and the knowledge of the medicines in an appropriate way, understanding both. And you see aphorism 9, the vital force. And even in the meditation philosophy is like we are all the souls. We are not the body, we are the souls. So there is something that is inside that is the vital force, the life force. And that is what makes the material body, and the sickness also starts there. And aphorism 15, 17, 19, all these lead to the shows the disease state, how it gets affected from the vital force. And aphorism 73, and acute diseases and exciting causes, aphorism 74, the chronic diseases and the conditions. Aphorism 31, aphorism 224, all this shows the spiritual nature action of the vital force. And as I said, like Adrian on your cortex and its functions, so deeply mention each at every level how the homeopathy can help. And when we see the temperaments and the nervous system, how it will, like, and the remedies are given accordingly to each one, whether they are slow, they are strong, they are hyper, melancholic, choleric. So the nature also sanguine, I am okay, you are okay, and all those things, constitutional and temperaments. So this can also be provided with the remedies and in this book. Dr. Rajneesh Kumar has done very good job, and it's really helpful with all the remedies what we see as Natswamika, arsenic. I cannot see that. I just wanted to see this mic read, but yeah, so very nicely mentioned. And the brainstem lesions, cranial nerve involvement, each thing very clearly mentioned. Cerebral lesions and the remedies that come, Naxwamic, arsenic, ignitia, lycopodium, and exclusivity dopamine, it acts upon the dopamine automatic nervous system. All the were clearly mentioned. Like with mind unreal, everything seems to be. You can think of aluminum, medullum. There's a nice repertoire that is provided by Dr. Rajneesh Kumar Sharma in that book. And mind pleasure, mind fear, fear of duty, aura. And the other book, From Heartbeats to Brainwaves by Dr. Rajneesh Kumar Sharma. See the type of brainwaves we have, gamma, delta, alpha, theta, and see based upon how each how we are like anxious, high arousal, and at that time these gamma waves are increased, and they are all for the high brain functions and emotional and mental well-being. And when they are decreased, we see in ADHD, depression, and optimal conditions, we see processing and for the proper perception, cognition, IM sleeper. And so the remedies for the gamma waves, increased gamma waves are arsenic, aconite, coculus cuprum, and carcinosin. And remedies for gamma waves decreased, we see anacardium, phosphorus, sepia, acaricus, and carcinosin. And the same thing with the beta waves, high frequency and low amplitude. And when it is mainly seen in the stressful state, uncontrollable thought and anxiety. And here the bilateral symmetrical parietal and frontal regions are affected, and the concentration is also affected. And increase mainly the adrenaline, anxiety, high arousal, and inability to relax. And it is decreased in the ADHD, daydreaming. And optimal conditions like conscious focus memory. And aggravations mainly the coffee energy drinks. And the remedies which we see for the beta waves increases arsenic, argonite, coculus, cuprum, and carcinosin. And the decreased beta waves also we have remedies like lacasis, natramor, sepia, aconite, and naxol. Mainly the alpha waves we see in the meditation. Like when we meditate, we become calm and relaxed. So that one, these alpha waves, and like increased daydreaming and so that one, and with their decreased like anxiety and high stress. So during meditation, these gets more. And any interventions is like alcohol or relaxants. And we have remedies according to the when the alpha waves are increased and when alpha waves are decreased as seen in the screen. And the theta waves, they are the low frequency and with help for the deep-seated emotions and mainly for the increase like ADHD and depression and decrease anxiety, mood, emotional awareness, and again optimal conditions, creativity, intuition, and theta waves are increased. The remedies are sepia, causticum, lacus, lycopodium, and platinum, and decrease theta waves, arsenic, echolate, ophilus, cuprum, and platinum. And the delta waves, again, these are linked to profound levels of relaxation and rejuvenation. And again, we have the remedies when the conditions are increased and when the conditions are decreased. Dr. Rajneesh Sharma has provided all this in the book ECG. And the research shows like what happens during meditation is amygdala, which is emotional center of fear. It is shrinking. For the long-term meditators, they show the empathy and they feel good. Like feel good hormones, dopamine are produced, making us more happy and sound mind. So, doing the mindful breath meditation that use this, so where you forget the time and space and become non-judgmental and accept the things as they are, and we feel satisfied and blissful. So, coming to the traumatic stress, and the homeopathic remedies, they're very, very good homeopathic remedies depending for all conditions, from simple depression to suicidal and many more, ignition, alcohol, and more. And during meditation, also the changes are happening in the quantum field energy. So I have done the studies with homeopathy and see how it is affected, and homeopathy and meditation, how the changes are seen, and just meditation. So in each cases, the clients are improving. And homeopathy considers this is psychosomatic and the same thing with meditation and heals from inside to out and many physical symptoms and everything. And there is one book, You're the Placebo by Dr. Joe Dispenza, which shows like several placebo researches cases has been documented and they are healed. And that is happening through meditation. So practical applications and incorporating meditation in homeopathic practice, it's must for all the doctors and encouraging patients to practice meditation alongside with homeopathic treatment and offering guided meditation sessions as a part of treatment plans. And benefits with enhanced intuition and empathy and overall progress and development of the practitioner as well as the improvement of the patient. It is spiritual growth. And this is one case which I would say that a ward long lasting standing single ward. And it has been there for 25 years. She has been on homeopathy also, but nothing has affected. But with the medication and this one, within 8 months, her ward got disappeared. And she was so happy. And even during a war also, when there was no anesthesia, then people were given just saline water thinking that this is anesthesia. And that is what is mentioned in the book, You Are the Placebo. So, and I have seen many cases where when the oral remedy or depression cases also, if the remedy is not there and you provide with that moral support and that all things, they are also healed. And another part like meditation, music can also be a meditation. Prayer can also be a meditation for the relaxation. And philosophical and holistic way of learning rubrics from alphabetical A to Z that was shared with all the mind rubrics. And pyramid meditation, which we are doing, we are here. Thank you to Brother Shreepad and credit given to easy quantum mechanics, how they showed that it works. And acknowledgement to all the references. And in conclusion, the homeopathic meditation together provide a profound approach of healing, address the body, mind, and spirit, leading to lasting wellness. And future directions is encourage more research, practice integration, promote awareness and spiritual dimensions of health. And final thoughts, embrace these practices for healthier and more balanced. And so I shared the homeopathic concept, like how I felt in the according to the principle, similia similibus curator. So my experiences, which I shared in the book Beyond the Limits, to inspire the others. So it is again based upon the homeopathic principle. And study group, thanks so much to our entire homeopathy study group who has been doing great job. And it's a one unity, and that's what we are happening with meditation and everything, comfort, peace, serenity. And through inspirational talks and many more things we are doing. And thank you so much to once again for everyone joining, and we will have the next session.
Thank you so much, Dr. Kavitha. Dr. Kavitha ma'am, for wonderful knowledge about the homeopathy and the meditation. And now I am inviting our second speaker, Dr. Shweta Singh, MD Homeopathy and PhD scholar. She is working as a senior research fellow in Central Council for Research in Homeopathy, headquarters New Delhi. Senior consultant, Orbit Clinic. She brings with her rich experiences more than 10 years. She had also completed the postgraduate diploma in health promotion from National Institute of Health and Family Welfare, New Delhi. And currently she is pursuing PhD in homeopathy from a reputed university. And she is the president of Delhi Homeopathic Medical Association and became the first female president of this association, which was founded in 1932 by Dr. Yaduraj Singh, first health minister, chief administrator of the KHA Homeopathy Study Group, USA, and chief editor of the biannual newsletter, Exploring Homeopathy, an initiative by the Orbit Clinics, and associate editor of the Homeopathic Heritage by BJ. And recently, she has been awarded with the legendary Homeopathy Award from the Health Minister of Uttarakhand, Shri Singh Rawat, on 21st August 2022, in the first National Homeopathic Conference in Uttarakhand, Ka Hanuman Award in May 2023. So I'm inviting Dr. Shweta Singh. Please continue.
Thank you so much, Dr. Mamata. And I would like to thank Dr. Kavitha Kukunoor for giving me this opportunity to share my views on evidence-based homeopathy in gynecological disorders. And I welcome all the participants who are present over here. So, evidence-based homeopathy in gynecological disorders. Females are the strong pillars of our society, and for an emergence of a strong, healthy society, we need healthy women. There are a lot of milestones which needs to be considered while we are treating a female, and same is mentioned by Dr. Henneman in aphorism 94 footnote that in chronic diseases of female, it is necessary to pay attention to pregnancy, sterility, sexual desires, accouchements, parturition, miscarriages, suckling, the stage of lactation, and the state of menstrual discharges. With respect to the last name particularly, we should not neglect to ascertain if it recurs. So we have to uh, ask the patient about her menstrual discharge, if it is regular, irregular, if it's coming late or early, if it recurs at short intervals, or how many days it lasts, whether the flow is continuous or not, or interrupted, what is its general quality, what is its color, if it is dark or if it is bright red, if clots are present or not, or if any associated complaints are there with the menstrual flow. We have to ask about the leukorrhea, white discharge per vagina, before its appearance or after its termination, but especially by what bodily or mental ailments, what sensation and pains it is preceded, accompanied or followed. If there is leukorrhea, what is its nature? What sensation attend its flow, in what quantity it is, and if there is any offensiveness. So we have to see what is the character of that leukorrhea, when it occurs, in what occasions it occurs. So we have to find out all these things when we are taking we are asking or inquiring a female. Then in homeopathic case taking, it is a process through which we know our patient and their sickness in every aspect, so that we can treat our patient in a rational way. We inquire the patient about with a lot of questions which are interesting, which are sometimes unique, weird, and strange to our patient. But why it is necessary? It is necessary to find out the more striking, singular, uncommon, and peculiar characteristic signs and symptoms of the case of the disease, which are chiefly and most solely to be kept in view to individualize our patient, because every patient is different, and we have to find out the most similar remedy which is suited to our patient. There are no specific remedies in homeopathy which is mentioned in aphorism 153. So we have to find out the more striking, singular, uncommon, peculiar symptoms in every case. The more general the symptoms, the more the general symptoms are present in every case. We cannot find out a simillimum on the basis of general symptoms, and every curable case has in it the singular, uncommon, peculiar symptoms which are the basis of our prescription. So we have to individualize each case depending upon these symptoms. Then we have to proceed for prescription. Now I would directly coming to the cases, because we are talking about the evidence-based homeopathy in gynecological disorders. So this is my first case of uterine fibroid, in which an obese female, 45 years, housewife, consulted me on 12th December 2023. She was diagnosed with uterine fibroid. You can see her report, which says that there is subserosal fibroid in the anterior myometrium, with approximate size was 25.2 into 19.2 mm. Presenting complaints were menorrhagia since 3 to 4 months. Character of flow was profuse, dark red with clots. Accompanying symptoms were heaviness in both the breast, which aggravates before menses. There was back pain, which aggravates after motion. In past history, she had cervical spondylosis since many years. There was pain at the nape of neck and back with vertigo. She was anemic with HB levels 10.5 gram per DL. She was diabetic, but she is taking allopathic treatment for the same. In general symptoms, the thirst was normal with the 1.5 liter per day. There is desire for salty things, chicken, non-veg, cold drinks, and tea. She was intolerable to spicy foods, which leads to burning, and there was aversion to sweets. Stools were occasionally hard, and the patient was hot in thermals, and the tongue was coated white. Mental generals, she was very irritable with her, and there was a lot of weeping. So this is the totality of the symptoms: menses, profuse dark, heaviness of chest, aggravation before menses, irritability with anger, weeping disposition, desire for salt, tea, cold drinks, aversion to sweets, anemic after hemorrhage, tongue white coated, hot patient. And the case was repertorized with these symptoms. And the most probable remedies which comes after repertorization were calcarea, phosphorus, sulfur, natrium, and arsenic. Now, repertorization is a mechanical process. After repertorization, we have to consult our materia medica to reach to the most similar remedy. Calcarea was there, but In our patient, there is not that great sensitiveness to cold, which is there in calcarea. Though the patient was fatty, fair, and flabby, but the characteristic insecurity, which is the core of calcarea patient, was not there. She was not that lazy, not that low spirited. She was very active, and the calcarea patient basically craves for sweets. But here in our case, there is aversion to sweets. There was not that sourness anywhere in this patient. So I just calcarea patients are chilly. So this is excluded. Then phosphorus. Phosphorus, as we all know, that it is a great remedy for hemorrhage, anemia. But in phosphorus, there is bright red hemorrhage. But in our patient, there is dark red hemorrhage. Burning was not that marked, which is there in phosphorus patient. Phosphorus patients are also chilly, but our patient is hot in thermals. So this remedy was also excluded. In sulfur, uh, the patient is hot, but there is craving for sweets, which is not a case in our patient. Sulfur patients are dirty, filthy, they don't like to be washed, they don't like bathing, and offensiveness is very much marked in the discharges, which is not there in our patient. On the next remedy, natramur. Natramur was just suited to our patient. Natramur craves salt. There is aversion to spicy things. The patient was irritable. They don't like consolation. They don't like contradiction. So, and the other features are also the patient is hot. So it is matching more with our patient. So I prescribed Natramur 200 in this case, followed by Auramur Natronetam 3x, one tab 3 times a day for 10 days. In the follow-up, the flow, she got her menses on 17th December, and the flow was reduced, not that copious, which was previous the case. There was heaviness in breast, which was much better. Back pain was much relieved, and irritability was also very much reduced. So I prescribed Rubram 200 single dose, followed by Auramune Natronetam, which was continued in this case, one tab 3 times a day for the next 10 days. In the next month, the patient was feeling much better. Back pain was much relieved. I repeated one dose of Natramur again and continued the Auramur Natronetam 3x. On the next month, the patient was feeling much better. The menses were regular, not copious in nature, and back pain was much relieved. And the next month, I again repeated Natramur 200 single dose and continued Auramur Natronetam 3x and advised the patient to go for TVS on the third month. Now you can see after third month, there was no fibroid in the TVS report, and you can also listen to our patient.
मुझको थोड़े दिन पहले पीरियड की शिकायत हो गई थी, जिसके कारण मुझे 2 महीने आया नहीं। उसके बाद एकदम शायद मुझे 1 महीना तक लगातार पीरियड आता रहा, जिसके कारण फिर मैंने डॉक्टर ने दिखाया, गायनी को दिखाया, तो उन्होंने मुझे बोला कि आप एक अल्ट्रासाउंड कराइए। तो अल्ट्रासाउंड जब मैंने कराया तो उसमें मुझको रसोली की शिकायत बताई। तो उसके थोड़े दिन बाद उन्होंने बोला कि अब आपको ऑपरेशन कराना, जिसके कारण मैं थोड़ा डर गई थी। फिर मैं थोड़ा रुक के मैं थोड़ा इधर पूछी लोगों से, तो किसी ने मिलकर एक उन्होंने मुझे डॉक्टर श्वेता के बारे में बताया, जो होम्योपैथिक की बहुत अच्छी डॉक्टर है। अगर आप उससे कंसल्ट करोगे तो वो आपको अच्छा इलाज बताएंगे। तब मैं उनके पास गई तो उन्होंने मुझे दवाई वगैरह दी। अच्छा अच्छा 3 महीने के बाद फिर उन्होंने मेरा एक और फिर अल्ट्रासाउंड कराया, जिसमें मेरा रसोली की शिकायत बिल्कुल भी नहीं थी, और मुझे बहुत अच्छा रिलीफ मिला, जिससे मैं आराम से मेरा ठीक हो गया। मैं बहुत अच्छा फील हुआ, मतलब कष्ट नहीं हुआ मुझे।
Now moving to the next case, there is one more case of uterine fibroid. An obese female of fair complexion, aged 33 years, came to me with her ultrasound report, which stated that she had intramural fibroid in the posterior wall, and the size was 12 into 13 mm.
In the presenting complaints, there were excessive bleeding during menses for the last 6 months. Menarche was at the age of 15. Menses were early, dark red, profuse, bleeding with clots. She has number of issues were 4, and all were the cesarean deliveries. There is in this case, I got an history of miscarriage, and for which one DNC was performed 6 months ago. The patient was diabetic, for which she was taking allopathic remedies, and in the physical generals, there was thirst, which is for large quantity, and the patient drinks often. Thermals were chilly. The significant thing which I found in this case was that DNC, which was very painful, which indicated that there could be some instrumental injury in the past. And on the basis of this, I prescribed Arnica 3x to that patient, one tab 3 times a day for a month. And Hypericum 1M was also given as an intercurrent remedy. And you can see the reports. You can compare the reports in which in the second ultrasound, there was only bulky uterus was there. There is no mention of fibroid. And on the next ultrasound, there was the uterus was appears normal with these remedies. Now moving to the next case, there was a case of endometrial polyp. Uh, a female aged 27 years, unmarried female, fair complexion, dark circles around the eyes. She came to me on 13th September 2020. There was the presenting complaints were there was intermenstrual vaginal bleeding since 5 to 6 days, and along with that, the patient was had very much weakness with trembling of legs. It seems that the patient was under some anxiety, or the patient was because in the history it was found that the patient was apparently well 5 to 6 days back. Then she started complaining of this bleeding when she urinates. She looks very depressed and sad when she came to me. And on further inquiry, it was found that some family disputes were going on for the last 15 to 20 days. Since then, she became silent and very much irritable. But the anger was quite visible to her face, but it was suppressed. She's not saying anything to anyone in the family. And otherwise, she was a very sincere, happy girl, but she was emotional too. Menstrual history was like 20 the menses appeared on 29th August 2020 for 2 to 3 days, and the character of bleeding was dark red in color with few clots. There was a history of acne in the past, for which she has undergone homeopathic treatment. On examination, because the patient was looking very dull, very weak, so her BP was also measured, and it was found that she was hypotensive. The BP was 100 by 60 mmHg. Tongue was appeared to be clean and moist. In the physical generals, appetite was quite decreased, and she doesn't want to eat anything. Thirstless she was, and there was desire for salty things. She was hot patient. Medical generals, you can see there is very much irritability in nature. She she found to be very jealous to because of that family dispute. She's jealous to her sister-in-law. She don't want to talk to her. She don't want to withstand her. There was contradiction which aggravates her. She became angry on slightest triggers but does not express herself. There was suppressed anger. She weeps only when alone. Consolation also aggravates, and she was very fastidious. On the basis of this, I repertorized the case: mind irritability, jealousy, BP, tearful mood, contradiction, aggravation, thirstlessness, salt desire, hypotension, trembling of legs, and hemorrhage, uterine metorrhagia. On the basis of this repertorization, the mark remedy which is coming is natramune. So in this case, this is her ultrasound report. I advised her to go for ultrasound, and it was found that there was ultrasound revealed that the endometrial lining was mildly thickened and heterogeneous in nature, echo pattern, and there was endometrial polyp was there, which sized 11 into 7.8. Now, on after repertorization, I prescribed patient Natramune 200. Follow-up was taken on 8th October 2020. There was no intermenstrual bleeding after the remedy. Patient physically and mentally felt better, and menses were profuse for 7 days. There were pustular eruptions which appeared after this remedy, but it is an old symptom. So this suggests that we are going in a right direction. So I prescribed Rubramate 30 for a month. After this, in November, I advised her to go for ultrasound, and there was no menstrual bleeding after that remedy. There were cracked and chapped fingertips in winters. There was hyperacidity with eructations was there, and there was back pain with stiffness. These are the symptoms which left over, but there was no recurrency of that intermenstrual bleeding. So I prescribed Natramune 1M because in the ultrasound, which I advised her to go for that, and I found that there is increase in the polyp size. Uh, Previously it was 11, and now it shows that it is 13.3 into 9.4 mm. So the polyp size was increased after Natramune 200. But one thing which is positive is previously the endometrial lining was heterogeneous in echo pattern, which was not there in this ultrasound this time. So I prescribed a higher dose of the previous remedy, Natramune 1M. But in January, it was found that the patient, on further inquiry, it was found there was no intermenstrual bleeding occurred, but back pain was still same. So on further inquiry, it was observed that there was hyperpigmentation over her cheeks. There was leukorrhea, which is white, thick, and offensive. And mentally, the patient was very much indifferent to her family member, especially her mother, because she took the side of her sister-in-law. But the patient was previously she loved her mother the most, but now she don't want to talk to her. She seems to be very indifferent to her. On the basis of this, I prescribed CPR1M, which is complementary remedy to Natramune. So I prescribed CPR1M, and after that, I asked the patient to go for ultrasound again, and you can see the report, which is very normal, and there was no endometrial polyp in the report. The next case, it is a case of ovarian cyst. A British complexion lady, 39 years old, came to me with left-sided ovarian cyst. There was pain in left iliac and hypogastric region since 3 months. Aggravation was during menses. More the pain when the flow starts. The menses were early, profuse, and prolonged since 2 to 3 months. Duration was 10 days. White discharge per vagina, thick, white, and little offensive. In the associated complaints, there was constipation, bleeding per rectum since 1 year, and on and off there was bleeding or bright red bleeding with pain during and after stool. There was pain and heaviness in legs. There is sense of fragility in legs. Muscle cramps were there or twitching was there, which aggravates at night and on touch. In the physical journals, the patient had a desire for tea, even if it causes flatulence, but she cannot resist the craving. She take around 7 to 8 cups tea in a day. She was constipated. There were history of piles, painful stools were there on and off with bleeding per rectum. Sometimes the pain is much that the stool recedes back, and perspiration was more around the neck and genitalia, and the thermals were chilly. In the mental journals, there was irritability on slightest trifles. There is anger towards her family members. She fights with her husband and mother-in-law on every little things. She was quarrelsome. Every contradiction aggravates, and there was dreams of falling. Uh, She jerks in sleep as if she fell down. And there were dreams of dead people. So on the totality was there was a left-sided hemorrhagic ovarian cyst, pain left ovary which aggravates during menses, pain aggravate with the flow, desire for tea, dreams of falling from high places, dreams of dead people, sweat on neck and genitalia, and there is brittleness of bones. There is a lot of fragility in the bones. This is her ultrasound report, which says that there is a left-sided ovarian cyst, hemorrhagic cyst of size 35 mm on the first visit. Now, on repertorization, the remedy come up were thuja, sulfur, murk, lechisis, and I went with the thuja because it is a left-sided remedy. It affects the ovarian. We will discuss it later, and you can see after thuja in October, I advised the patient to go for ultrasound, and it was a normal scan after a single dose of thuja in a month. Why I prescribed thuja was because thuja has its profound action upon the glands with stitching, tearing pains. The pains are as if the glands were being torn to pieces. The ovaries are much more affected than any other glands, especially the left. So, thuja is a left-sided remedy which has more affection towards ovaries. There was violent pain in left ovary coming on at the time of menstruation and continuing during the flow, which was the case in our patient. The pain extending down the thighs or in any direction, it increases as the flow comes on, stinging, tearing, burning, bursting pain, as if the parts were being torn out, makes her cry aloud. She goes into a hysterical state. In the mental symptoms, uh, we have already discussed that the patient was quarrelsome. She fights with her family, with her husband, with her mother-in-law. So in Thuja, mental symptoms include irritability towards her family member, which she is yet able to control in front of stranger. She's very manipulative. She won't show that irritability towards her family members in front of any other uh, strangers. She wants to be alone. She has that emotional sensitiveness. There is no use trying to reason them out of her. It seems to her that she's very delicate. She's made of glass that she will break. So we can see that in our patient, there is a sense of fragility, brittleness in the bones. So Thuja patients are also very delicate, as if they are made of glass, they will break. Music causes weeping and trembling in Thuja patients. When walking, the limbs feel as if made of wood, sensation as if limbs were made of glass and would break easily. Perspiration, as in our patient, there was perspiration on neck and genitalia. So in Thuja, it was also found the perspiration was on uncovered parts all over except head when he sleeps and stops when wake up. Profuse sweetish nature, smells like honey, sometimes like garlic, strong and pungent. A pungent odor from the genitals, sweetish honey-like odor to the sweat from the genitals, and such orders are particularly present when there are fig warts. So in the wart cases, if such perspiration you can experience, so puja can be the remedy. Our patient was a heavy tea drinker, and in Clark it is mentioned that people who are all vaccinated and drinks tea, Thuja is the greatest antidote to tea and vaccination. So overall, Thuja covers the totality of the patient. So I prescribe Thuja in that case. Now the next case, it is a case of isthmosil. A lean, thin patient came to me who is 29 years old. She was on 27th November 2023. Presenting complaints were excruciating pain in her lower abdomen since 6 months. which aggravate on motion while sitting in a squat position and during menses, amelioration after lying down position, in lying down position, and on bending double or by warm application. General weakness was also present with this pain. There was white discharge per vagina, whitish, thick, stringy, offensive discharge occurring on and off since 10 years, which aggravate while sitting and urination. In the associated complaints, there was pain in a sacral region, and burning soles were there, which aggravates in evening. In a gynecological and obstetric history, there was a history of cesarean delivery. Isthmocele is basically after, it is a complication of cesarean deliveries. So menses were regular, duration was for 4 to 5 days. Flow was bright red in color with little clots associated with dysmenorrhea. On general examination, the patient was also found to be hypotensive. The BP was 92 by 70 mmHg and pulse was 84 beats per minute. Physical generals, the thirst, she was not much thirsty, drinks only 2 to 3 glasses per day. The thirst was decreased, tongue was clear, and thermal reaction was chilly. Patient was also in the state of anguish, and there was a lot of fear of pain because it was very much excruciating and severe. On the first prescription I made was staphysagria, followed by Macphos 6x 3 times a day because there was amelioration from the warm application, bending double, and staph is a good remedy after operative deliveries or operations for pain. So this is her ultrasound on the first visit, which she says that there is a presence of evidence of hypoechoic collection in the endometrial cavity extending up to the isthmocele, and this is the thing. And justification of the remedy, staph I prescribed because the complaints in this, it is mentioned that complaints arising after post-surgical operations with stinging, smarting pains like the cutting of a knife, produces colic or severe pain following abdominal section. It is a useful remedy for incised wounds, clean cut as after the surgical operations. The genital parts become very sensitive and worse sitting down and better by warmth. It is a great remedy for leukorrhea. So I prescribed staph in that case. In the follow-up, leukorrhea little decreased, but the pain was found to be same. I again prescribed staph in higher dose, staphysagria 1m, followed by Macphos 6x. But on the next follow-up, it was found that the pain was same. So I prescribed hypericum in that case because the hypericum is also one of the remedy which relieves pain after operations, and pain were very much severe in that case. So I prescribed hypericum 200. It also didn't relieve. The pain was severely aggravated after hypericum 200. It became intolerable for the patient. She was unable to sit in any position. Slightest touch aggravated her pain. Also, there was thick blood-tinged mucoid discharge noted by the patient while urination. So in that case, staph didn't relieve, hypericum didn't relieve. Then I prescribed strontium carb 30 ch in twice a day. Why? Because strontium carb, which is also known as the carbonate of strontia, is a remedy used for shock after surgical operation. It is useful for chronic sequelae of hemorrhages after operations with much oozing of blood with prostration, which was there in our patient. There was oozing of that blood, and there was the weakness was there. Relieves pain that make patient faint or sick all over. It is a great remedy for neuritis. The remedy also covered the modalities of the patient like amelioration from warm application and aggravation on motion. So I prescribed strontium carb 30 twice a day, and this is the follow-up. In a week, the patient came with a smile on her face there was a sense of relief which was quite visible this time, and she had 70% relief in her pain. She can easily sit in squat position, which was not the case prior to this remedy, and leukorrhea was also decreased. And after 15-20 days, I advised her to go for ultrasound, which was found to be normal, and there was no significant abnormality found in this ultrasound. So this is from my side. Thank you so much.
Thank you, Dr. Shweta, for a wonderful presentation. And now we will have another session, qualitative research on anemia in patients with diabetes mellitus by Dr. Shreepad Hegde. Dr. Shreepad Hegde is MD Homeopathy, MS and PGDHA, former professor and HOD of Government Homeopathic Medical College and Hospital, Bangalore. Special Committee of Homeopathic Pathogenic Trials, CCRH and Ministry of Ayush. His senior positions in various organizations, NIH, HAL and CO, author and editor of various publications, 36 years of teaching experience and 39 years of research-oriented clinical practice at Bangalore. Presently, he is the member of Special Committee of Homeopathic Pathogenic Trial and governing body, National Institute of Homeopathy, Calcutta, and he is also the director of Tava Homeopathic Research Center, Bangalore. He also presented 100 plus scientific papers at various prestigious national and international conferences and talk shows on radio and television. He is the recipient of many national and international awards. Above, he is the Yakshagana artist and dancer and event organizer. And we welcome you, sir, for this session. Thank you.
Very good afternoon. And I am very happy and proud to be on this platform. It is also especially a very divine place like Remedy Valley. You know, although it is very near to the Bengaluru city, feels that it is far away because of its serenity and divinity and peaceful in its nature. And we forget that we are in a cosmopolitan city like Bengaluru. So good atmosphere and so peaceful and silent. And I would like to congratulate first that Dr. Kavitha Kukunoor, making her mind that to have an international conference at this holy place. Give her a big hand. Make it. See, I appreciate her because of two things. One is she wanted to have it here, and somebody suggested it is far away from the city. She just put a note to me that whether shall we have it there only or not. When I was visiting first time, after going through on the net, I said no, that is the place. And we came to conclusion that the quantity is not important for us, quality is more important. Whoever is interested, they should come and join us, and we will have the discussion that will be very peaceful way and very serenetic way. That's why how we could able to gather here. And by the same time, I would like to congratulate and wish all the whole team of, in short, they call it like Kavitha holistic approach. This team is very sportive, you know. So maybe now what Dr. Shweta was presenting, and they have Dr. Mamata, Dr. Bhavana, Dr. Deepa, like that many are there with her, and though they are away from this place, but they could able to take a decision. Even Dr. Rajneesh Kumar and so many other, even Sharma, Deepika. I don't know all these persons personally, but still I could able to make out that overnight they take a decision and immediately they come to a conclusion and they take a very interesting step to go ahead. This is what positive thinking, madam, that you carry with you. That's why you could able to succeed in the making such functions. And now we'll go to the session what we supposed to have today.
Some mic. Mic.
Hello. Yeah. I hope now the things are settled down. To confirm something.
Yes, sir.
I think I have talked somewhere here. You go back to the definition, the World Health Organization, and very clearly anemia is a condition in which the number of red blood cells or the hemoglobin concentration is lower than the normal. Hemoglobin is needed to carry oxygen, and if you have too few or abnormal red blood cells or not enough hemoglobin, there will be a decreased capacity of the blood to carry oxygen to the body's tissue. See, this results in symptoms such as fatigue, weakness, dizziness, shortness of breath, and among others. These are the vague complaints, and it is very difficult to identify it because of the anemia. The optimal hemoglobin concentration needed to meet physiologic needs varies by age, sex, elevation of residence, smoking habits, and pregnancy status. Most common causes of anemia include nutritional deficiencies, iron deficiency, deficiencies in folate, and deficiency of vitamin B12 and A, and hemoglobinopathies, and infectious diseases such as malaria, tuberculosis, HIV, and parasitic infections. See, these are all the different causes for pernicious anemia. In the pernicious anemia, the decrease in red blood cells that occurs when the intestine cannot properly absorb the vitamin B12 especially. Vitamin B12 deficiency anemia is most common, and the body needs vitamin B12 to make red blood cells. To get this vitamins from eating foods such as meat, poultry, shellfish, eggs, and dairy products. A special protein called intrinsic factor helps your intestine absorb vitamin B12. This protein is released by cells in the stomach. When the stomach does not make enough intrinsic factor, the intestine cannot properly absorb vitamin B12. Common causes of pernicious anemia include weakened stomach lining, means atopic gastritis or a chronic gastric infections, an autoimmune condition in which the body's immune system attacks the actual intrinsic factor protein or the cells in the lining of the stomach that makes it. Then these are all the causes we see, like excessive bleeding, leaky gut, which is repeated diarrhea, that along with that micro hemorrhages may be there, the low stomach acid, and iron deficiency, B12 deficiency, folate deficiency, poor diet means where they need only the junk foods, which is required that they may not be taking. The chronic diseases and intestinal disorders and infections, kidney disease, liver disease, thyroid diseases, pregnancy, enzyme deficiencies, and autoimmune disorders. And these are the typical categories. We say that increased loss of blood volume or red cells is acute hemorrhage or gastrointestinal bleeding. And number two is increased destruction of red cells, like autoimmune hemolytic reactions or drug-induced hemolysis, and decrease in production or differentiation of red cells, like bone marrow failure, disruption of the supply of raw materials involved in erythropoiesis, erythropoietic deficiencies, like that, and miscellaneous causes like anemia of chronic diseases, in the diseases like cancer. And these are all the manifestations. I think you are aware of that, and I'm not concentrating much on that. And this is neurohumoral activation, how the anemia happens with the physiological changes which has a very important role and control over the hemoglobin production as well as destruction, as well as retention of the iron and all these phenomena. Now, anemia is one of the world's most common preventable conditions. Still, it is often overlooked, especially in people with diabetes mellitus. Diabetes-related chronic hyperglycemia can lead to hypoxic environment in the renal interstitium, which results in impaired production of erythropoietin by the peritubular fibroblasts and subsequent anemia. Anemia in patients with diabetes mellitus might contribute to the pathogenesis and progression of the cardiovascular disease and aggravate diabetic nephropathy and retinopathy. An emphasis on regular screening for anemia alongside that for other diabetes-related complications might help to delay the progression of vascular complications in these patients. The elevation of the inflammatory cytokines plays an essential role in insulin resistance and induces the appearance of cardiovascular complications, diabetic micro and macrovascular and kidney disease and anemia. See, many times this anemia is ignored and neglected and they'll end up with so many complications. By increasing the inflammatory where interleukin 6 anti-erythropoietic effect occurs since this cytokine changes the sensitivity of progenitors to erythropoietin and also promotes apoptosis of immature erythrocytes causing a decrease further in the number of circulating erythrocytes and consequently causing a reduction of circulating hemoglobin. See, due to the development of diabetes mellitus, the nephropathy may arise, which further undermining the renal production of erythropoietin, positively contributing to an increased anemic favor. Approximately 40% of diabetic patients are affected by kidney disease. How it is related to see anemia, which has an effect on the diabetes, and diabetes indirectly have an effect on anemia, and which leads to kidney diseases. How the diabetic kidney problems will arise, and many they are not aware because of the hypoxia which takes place in the kidney or in nephrotic cells. The decrease in renal function and pro-inflammatory cytokines are the most important factors in determining the reduction of hemoglobin levels in those patients. The inflammatory situation created by kidney disease also interferes with intestinal iron absorption and mobilization of inventories. Therefore, diabetic patients with kidney disease have the highest risk for developing anemia. And many times we don't even identify where the chronic diabetic patients. At least out of your interest, try to get the serum creatinine level as well as other kidney functions, then you may get a better idea that there may be a problem with the anemia which has some impact on the kidney functioning. Diabetes often leads to kidney damage, and failing kidneys can cause anemia. See how it is interrelated. Healthy kidneys know when your body needs new red blood cells. They release a hormone called erythropoietin, which signals your bone marrow to make more release of this. And damaged kidneys don't send out enough erythropoietin to keep up with your needs. And often people don't realize they have kidney disease until it is an advanced stage. But if you test positive for anemia, it can be an early sign of a problem with your kidney. Just try to understand this. Ma'am, there increased oxygen level, hypoxia, which leads to the kidney problems, and erythropoiesis, and how it will be able to stimulate the bone marrow to increase the more erythropoiesis activities. If this chain is disturbed or the broken, naturally patient will end up with anemia as well as kidney problems. And World Health Organization guidelines recommend an investigation of anemia. And the hemoglobin concentration is less than 12 grams per dilution in women and less than 13 grams per dilution in men. Using this definition, nearly 1 in 4 patients with diabetes, this maybe 23%, have anemia or a TIG evaluation. The study is taken up to find the effectiveness of homeopathy in the management of anemia in diabetes mellitus, because anemia is a common complication of diabetes mellitus and an independent contributor to the pathogenesis and progression of other diabetes-related complications. Then here, where I have taken up 10 cases from my OPD, where were fulfilling the following criteria like known cases of type 2 diabetes mellitus, they are under treatment, who also suffer with anemia with hemoglobin below 9 gram per dilution without any diabetic complications requiring other forms of treatment. The selected cases were treated homeopathically using the simillimum based on the totality of symptoms, and the results were tabulated after 6 months of treatment. The outcome was measured using date were treated using mean and standard deviations. I hope our PG scholars will follow and understand it better. And the result is this episode is that diabetic patients where anemia which is an anti-diabetic treatments treated with homeopathic medicine for anemia. See, this is the chart. Here, fasting blood sugar level, postprandial blood sugar level, as well as hemoglobin before and after treatment, for the what changes have taken place, and what are the medicines have been used in the different cases. Very interestingly, the first case had hemoglobin percentage of 8.2, which has increased to 11.6, where China was the main indicated remedy, and in the second it was hemoglobin 8.1, which has increased to 12, as acid phos was the remedy. Here, whatever the medicine they were taking for the diabetes, without disturbing that, the patient has treated along with that, and this is the improvement what we have seen. In some cases, they have responded. After that, we could able to reduce the even diabetic medicines what they were taking. And third case where we have used the Argentum metricum, the fourth one 8.9, and later it has improved to 11.5. The lycopodium was the remedy. Fifth one 8.3, it has increased to 11.8. Phosphorus was a remedy. And sixth, this is 8.4, which has improved to 11.6. Calcarate was the remedy. And seventh one was challenging, where 7.8, which has improved to 11.2. The Metramol was remedy. And eighth one 8, and it improved to 12.5. The phosphorus. And ninth is 7.8, and it has improved to 12. Aramate was the remedy. And 7.4, this is the 10th one also challenging. You could able to show the improvement up to 12.4, so phosphorus was the remedy. There you could able to see the graphical representation, how much was the hemoglobin before treatment, and after the treatment, how much improvement has taken place. And the mean value, this is a statistical evaluation, where we require a proper presentation and calculation. The absolute value of the calculated TX60 critical value, that is 16.17, is less than 1.8. So the means are significantly different. Thus, you can conclude that the treatment is effective in the management of anemia in patients with diabetes mellitus. We have a very strong and effective medicines which could be able to help the anemia in the patients of diabetes mellitus very positively. Now, let us discuss about one or two cases. This is a lady where 47 years old came with the complaints of type 2 diabetes for 5 years, known case of anemia for 3 years, mild vertigo for 2 years, severe weakness for 2 years, irregular menses for 1 year, and vertigo on and off for 6 months. See, the details of the complaints are like that, where patient was diabetic for 5 years and she was on allopathic medicine. There's like a phase where morning 1 and night half, so I taking great exhaustion, weakness, giddiness, on and off, and heat sensation, hot flashes. Menses sometime early, sometime late, excessive flow, the black, thick, mild pain in lower abdomen, bleeding per rectum 4 to 5 days before menses, is very watery, vertigo on and off, sensation to fall in the morning and in bed. See, this is very difficult to decide. This vertigo is due to anemia or due to the menopausal changes or due to diabetes. See, all these things have been a lot of confusion. The family history, the father was diabetic, mother hypertensive, and he had a heart complaints also. And critical history says 3 conceptions, first one full term normal delivery, second one full term C-section due to breech presentation, third one where they did a medical termination, third month. Menstrual history, irregular menses with a heavy flow for 7 to 8 days, sometimes with the clots, and these are the last menstrual periods. Now it is early for 3 weeks or sometimes 25 to 40 days, means sometime early, sometime late. This is the presentation. Each time heavy flow, utilization by just lying down. For last 6 months, bleeding per rectum before menses. This is another cause for anemia. You know, first of all, the menstrual flow was small. Along with that, it's a bleeding per rectum also. Watery, dark, red hemorrhage before or maybe during also. She could not able to notice fatigue and giddiness 1 week before the period. See, these are there is no euphoria. And here in the personal history, it's not much specific to say that, except the constipated or days before the menses. Patient is ectodermal. A patient was born and brought up in a middle class with a life specific stage, a Marwadi family. She lives in a joint family who has some business, less education, more responsibility of children and in-laws, tired of adjusting with 2 co-sisters. Husband is bothered about profit and loss. Since you know the Marwadis, they are after business, and mother-in-law is bossy in nature. She has to manage her also. In joint family pictures, I hope who lived with that they understand, and fear of blood loss and giddiness. See, the adjustment with the mother-in-law, father-in-law, co-sisters, all these things are a big problem. And of late, because of the unique family nature, see, they struggle a lot to adjust in the family. And this stress is another cause for their problems. Why they say stress, they don't know. So many times it happens that this is typically this lady is facing that. She is a well-oriented with time, place, and other things. This is just a study. The eyes conjunctive of pain, what is clear? Total care is on examination in detail. Blood pressure 130 by 90. This is in a border, and pulse 78 irregular. There is no other manifestations in the respiratory system or other systems. For abdomen, we could able to see the tenderness on epigastric region and mild enlargement of the spleen. This enlargement of the spleen is natural in many anemic patients, but one should have a habit of examining the abdomen also. These are all the reports, the different dates, to be able to see the hemoglobin percentage as well as fasting blood sugar and postprandial blood sugar. It is 9 was 8.6 hemoglobin percentage, 9.2, so 10, 10.6. Slowly it has increased 12.5, and then again 12. This is the level of the 12. This is how you could able to understand the mental journal, physical journals, and characteristic particulars. Mild, gentle, lean, thin constitution, uterus, menorrhagia, irregular menses, more flow, watery, thick, black, scissors on line, sympathetic, epithermal, rectum bleeding before menses, hot sensation, hot flashes with chilliness, urination, incomplete feeling, the patient that is retention. Concerned about husband's health because he chiefs that vodka, Zarda, funny, they have a this go on eating. Fear of disease, fear of falling, vertigo sensation to fall on picking, and which my homeopathy in India. But I believe it will. You can feel any bad, you can make a treatment, but then what is the remedy? The remedy which comes, you can suggest. Others also they can unmute and they can say, no problem, now I think my patient is settled. Still not very good. In fact, they can unmute See, this is the pepper drill. That my school will keep it as a suspense. Let us discuss case. These are the symptoms which are taken for the perpetration, and which is the perpetrator charge, which came out with the cases, continuous area. Scores 22 marks out of 11 symptoms, like I said, Calcarea, Sepia, and Swamika. So, what was the treatment given to? See, on 25, 3, 70, I have started the Deepa. There was no changes. Because the presentation was so like that. Sorry, not like that, China. I started with the China because typical indication like a hemorrhage and bleeding for rectum, hypertension, and giddiness, vertigo, and fatigue. All these things were a lot of that. But later, there was no change. They were shifted to the lycosis after repetization. Along with that, I gave the collapsing mother tincture also to control the bleeding. That has helped a lot in the case. Then it has been even taken help of iron capsules in between because hemoglobin was so low, came down to 7.4 and all. And in between, she had a epistaxis, very interesting thing. See, where the hemorrhagic tendencies are there, one or the other way they will have a bleeding. See the bleeding from uterus, bleeding from rectum, bleeding from nose. See, this is a typical hemorrhagic diathesis, what we call hemorrhagic tendency. That is the thing this patient has blood. She had epistaxis also and ammonium chloride helped to control that as one of the other complementary remedy. Again, the diathesis treatment doses helped and she improved. And you could able to see the menses has stopped 5 months back and she was better. Then she just you see when she reported me back after almost 2 years. 12/6/2020, she came with a new complaint. This is very interesting. Spotting after coitus for 3 months. 1.5 she is getting. This is a new complaint, but nothing to do with the anemia or other things. They are fine. Patient is able to maintain the things. And what is the remedy for this? I have treated with one prescription of 3 course of medicines that patient has improved. Are you good? Very good. You are a big hand. She said, Sepia. Dr. Manisha Chopra said, Sepia. My experience, I think, by prescribing to the patients, they will use it. You see, and one more thing I will like to tell you, any such bleedings are there. One has to rule out the malignancy also. CA cervix is the most common thing that I have seen. Such bleeding spots, even it may be just one spot also, or even they have seen just a discoloration also, but one has to rule out because cessation of the menses. After the menses, there is a flow, there is a discharge, there is a visual. Even I remember maybe some during COVID time, a lady of 72, she came with that the bleeding has started. And immediately I said it is a cancer. I have not told the patient, but patients are not regular and they took her. And for your information, I will take you because in the first stage of CSO, that lady didn't notice anything. It was really very bad, worst case of cancer cervix. So one should be very careful in such cases. Okay, this is a next case we will discuss. 57 years. Madam, I think maybe another better issue. He is an advocate by profession. See, this also will be here because 17 and this person's case is also there in your study. And it's a known case of type 2 diabetes for 10 years. Known case of hypothyroidism for 10 years. See the multiple complaints. See their diagnosis is FLO 5-6. Severe sneezing and oral emission allergic rhinitis for 6 years. Severe weakness for 5 years. Abdominal pain on and off for 5 years. and buzzing sound in right ear for 2 years. Varicosity of veins, the bilateral where both the lower limbs are affected with a crisis of their veins. See, these are all the complaints. I don't think here any organ has been left in his body except maybe his brain. All the organs have been affected. You can just see, I'm just saying, see diabetes, hypothyroid, thyroid organ, and as well as respiratory organ is involved, and there is a weakness there. There is a very severe anemia, this buzzing sound, and the very severe fatigue. All these things are actually because of the anemic problems. And this fellow is on these allopathic medicines, Glycomet 500 mg daily once, and for hypothyroidism is on Thyronol 100 mg that weakness, daily once, drowsiness, fatigue, severe weakness, severe sneezing, running nose, on and off, and aggravation early morning, but winter season, mutilation bar, associated with decrease in perception of smell naturally, because maybe repeated using the nasal drops and so many other things, sensation might have been gone permanently. And anemia, gastritis, gradual onset, cause untimely food habits. You know, the advocates, they don't eat properly, they don't allow others also to eat in time. That is usually that professional people of legal advisors as well as this what I have seen. I don't know, your experience may be different. Severe burning pain in the stomach with hot sensation, distension of abdomen and loss of appetite. He was afraid to eat because of eating immediately because of the pain by burning increases. And these are all the complaints are more prominent during 3 to 4 a.m. in the early morning or after eating or combination by drinking water, but there is no vomiting and wasting and making sound in the right ear, on and off attacks of giddiness. He says sometime in the morning he cannot able to go or do the proper walking. Aggravation at night, morning, no discharge from ear or anything. See, treatment history I told already is on so many medicines, many allopathic medications taken for gastric complaints, and he might have had almost within 3 or 4 years, some 3-4 times endoscopy has been done, colonoscopy has been done, gastroscopy has been done. He says that my channel has been broadened now because many times the pipe has gone and came out. See, now I am fed up with that because you know the endoscopy or a colonoscopy, all these are very painful procedures where we cannot able to put a liquid, we cannot able to put a bolus of food. Then you are putting a pipe in that and you are doing the examination. And he underwent a GAVE. This is a very interesting thing. Gastric antral vascular ectasia with endoscopic banding has been done on 7560. I don't know how many of you are aware of this procedure. This procedure they use to stop the bleeding at the gastric mucous membrane. At the gastric mucous membrane, where gastric antral vascular ectasia to control that bleeding because he had a microvascular bleeding at the mucous membrane in the gastric area. That's why he was developing the anemia. For his cause was that, and you know, usually that's another important topic for the study is gastric ulcer in diabetic patients. They are more prone to get gastric ulcer or a peptic ulcer like that only. That is another very important subject. Many who are not aware of that. And many times, such peptic ulcers or the will not be corrected. And in this person, they did that banding. And this banding, many times they do, very severe cases of esophageal varices also. And it gives a very good relief. Along with that, our medicines, I have treated many patients. Many patients we were able to diagnose it as early as possible. Otherwise, possibilities are like that with the esophageal varices, the patient may collapse and he may die also. I have seen even some deaths also because the bouts of blood which comes out so big quantity, even 500, 600 ml, because of the hypovolemic shock they die. It's very dangerous. This one should be aware of that. And this one has already undergone that. We gave the gastroenterologist, and sometimes the gastric lavage has been done. I told him, he is an experimental animal he became. And history of moderate edema of both the lower lips with a mild varicosity. This edema is again another challenge for you. This edema is due to anemia, or this edema is due to varicose veins, or this edema is due to this diabetes for a long period, which is there in the patient. Because in all these conditions, edema is common. The thyroid, hypothyroidism is edema, and in edema, pedal edema is very common. Then generalized anemia, where we see the hypoproteinemia or anemia. So naturally, being a diabetic, he was on many diet restrictions. Naturally, he suffers from hypoproteinemia. So the hypoproteinemia, edema is common. See, these are the things where we should be able to understand before selecting any simillimum that what may be the positive factors or see this is a gastroenterologist who said that but he has seen and he could able to do the gastroenterology things. And in the family where grandfather was diabetic, mother was diabetic, mother was hypertensive as heart complaints, and the wife is suffering from hypothyroidism. But for information, daughter is suffering from autoimmune urticaria. That was another autoimmune disorder which runs in the family. And he said, you are vegetarian, nothing to say. He is adapted to say that he is a teetotaler. There is no drinking tea, coffee much, there is no alcohol, there is nothing, but still he suffered from this. That is very interesting and important. He had a regular food habit during his higher education. He was very sensitive to see his diet. Being an advocate, at the beginning of his practice, he had disturbed food habits as well as consuming more tea and coffee. This is the beginning of the practice naturally in the company and others. He is more concerned about his clients and family members. He has a more attachment with friends and their family members because he usually worried or bothered about others' problems than his problem. That is his specialty. And you reading many drugs in America, such personalities. He is well oriented, other is a well highly educated person. Here you don't find much changes in his examinations. You're able to see where blood pressure. Weather was very well marked. Pulse was 76 beats per minute, regular to the morning, pressure was not possible. See, otherwise, he was all right. Blood pressure was normal. The respiratory system or cardiovascular could not able to find anything. But for abdomen, you could able to see the tenderness on epigastric region, mild enlargement of the spleen as well as liver. Means the mild enlargement of hepato as well as the spleen. And this is the diagnosis already I told you. Type 2 diabetes mellitus, hypothyroidism, allergic rhinitis, erosive gastroduodenitis, pernicious anemia, venous disease, varicose veins. See, these are the 7 diagnoses. One patient. And these are the thyroid value. See, should have to the date 11.6. This is the Doppler study of it. This is what the banding has been done to give what I was talking about gastro. See, this is a voice. Because after some time they said it may be required again one more sitting of banding. Then after that they did it, but still these problems were persisting. Then what will be the myasm now? But so many diseases. Aquatic cases. Drops. See, then what may be the remedy? Now we had we agree. This is very different out there. There's a medical problems and restrictions everywhere. See, even at the vascular level, even at the gastric level, even at the diabetes. See that. It's fine. Anemia, repeated hemorrhages are there. There also there is hemorrhagic tendency. Here, the hemorrhage is probably gastric it was continuously leading to anemia, and anemia which gives rise to this sound, buzzing sound in the ear, so that will be more evidence. So it is related to each other. The like that, that's what I'm talking. And diabetes is super added to that, along with that, hypothyroidism. See, there is no chances, and it's already there for 10 to 12 years or 15 years, where he is suffering, and repeated sufferings made him that he lost interest. And we have started with this analysis. The mind gentle, personality, constipation, stomach pain, aggravation 3 to 4 a.m. See, by seeing 3 to 4 a.m., naturally everybody will think of early morning aggravation, it may be potassium group where Kali may help. And see, as you all think, also started the Kalika. When we started, his hemoglobin percentage was 8.4 and sugar level was 105 and 4.8 was 136. But for my this thing, I don't find much changes. Yeah. See, we started with the Kalika. And I didn't find much relief for the changes. Again, the study has been done, and see, these are all the things in the totality of symptoms. We could able to make a note on the stable circulation, sensitive to changes in temperature, respond to reassurance and gratefully, trustingly. And he likes to speak many of his intimate friends. Anorexia with irritation of food, unexplained prostration, violent burning pain behind the sternum and stomach, as a heavy weight in stomach, and it irritates, inflames, degenerates the mucous membrane. These are the qualities of which drug disorganizes blood, causes fatty degeneration of blood vessels, issues, give rise to and picture of restrictive metabolism. My students will answer very fast. Because they have seen many such lectures. And these are the referred to totality. I will not read again. See, this is the repertorial symptoms as well as repertory chart. Good able to see Naxomica, phosphorus, ecopodium, bacteria, carbohydrates, and Kalika, like see, these are all the scores of remedies. Now you can think with this constitution where it stands, how better to be able to help. This remedy can be given. As a Naxomica, to say that this is an acute superficial active remedy, and in this case it may not be useful much. You have to either go to the phosphorus or the ecopodium or the carbohydrates. So we started with the phosphorus. And patient started responding well. Initially, there is fluctuations, phosphorus very by days, and later followed new very for 3 days, and immediately placebo has been given. Then it was monitoring, and in between we had taken help of Naxomica, where he had some loose motions after party functions and all, and I have taken the help of fluorescent also as an acute remedy to reduce the severe abdominal pains, and phosphorus has been increased in the potency due to anemia. But we could able to see where the hemoglobin was 10.8, it came down again to 8 on 23, 180. See, this is not a good development in the patient. And I use the China in between of his presentations like a giddiness, sound in the ear, frustrations, as well as repeated fatigue and all, but that also didn't help much. And it came down to the 7.1. Then you can see the hemoglobin 10.8, which came down to the almost 9.8, 7.1. See, patient lost hopes. So he said, sir, I'm going down again and again. See, then phosphorus again repeated after this. Syphilinum anemia has been given for 2 days. So, see, this is a very important and turning point in the patient's recovery. Then he started improving. After the antimasphatic recurrent remedy, the syphilinum, patient started improving. See, hemoglobin came up again 10.2. Still, there is a cramps and other things, and phosphorus has continued. And his hemoglobin started improving. See, from 10.2 to 11.6 it came. Phosphorus continued. His fasting blood sugar and post-mortem blood sugar is also almost under control. And on 9/6/18, we could able to see hemoglobin percentage. Still, it has improved. It came to 12.4. This is a very good result where the patient got it. And in between, I told no like a Somika, Molosip, acute remedies have been used for repeated other purposes. Then his hemoglobin almost became stable, 11.8. In between, I have taken the help of CCGM other things also. For the patient that you can see. Balani.
I'm suffering from gastric. And the last year, it converts it into ulcer. Then I went to take treatment at Aster Super Speciality Hospital, Bangalore. The doctor says that after thorough checkup, it is converts into chronic ulcer. Then, lastly, they have made 13 bandings in gastro system in 2 times. I have not recorded properly, and lastly, then third time I have been to take treatment at Aster. They have suggested that this is a chronic ulcer. Now, if the operation was not made, it may convert it into cancer. Then, at that time, my hemoglobin level is at 5.8%. Surprisingly, I have met Radha Shweta Reddy Akka of Bangalore, a well-wisher, to ask me to meet the Dr. Shreepad Hegde, Professor in Homeopathy at GHMC Bengaluru. I have met the doctor along with Radhaka and the doctor counseling around 1 hour. Then the doctor gave me a treatment from that day. Radha Shweta have met the doctor gave me a treatment once. I have lost my stomach pain and improves my hemoglobin level up to 9.8. Now I have no pain at stomach and my hemoglobin level is at 12.8. The doctor cures my disease, that is chronic ulcer, without operation. It is a miracle of homeopathy.
Okay, this is a small study. Effectively conclude that homeopathy is effective in the management of anemia in diabetes mellitus, thus preventing the pathogenesis and progression of other diabetes like complications. Yes, now the discussing to see what everybody else has seen and to think what nobody else has thought. That's what we able to get a proper recording as well as maintaining the statistics. We could able to produce in front of the society that it is effective and we could able to handle many such cases. Okay, I thank you very much. In between, developing ulcer, hemorrhages, vomiting, epistaxis, like that, many problems came, but ultimately we could able to succeed. I thank the organizers, Dr. Kavitha madam, as well as others who are all involved in the organization of this conference. Thank you very much. Thank you, one and all.
Thank you. Thank you, Hegde sir, for wonderful sharing knowledge about the anemia and diabetes. And now I will invite Dr. Rajneesh Sharma for his lecture. That he is a BSc, BHMS, MBBS, MD in homeopathy and ADI London. And he is a privileged and executive member of Delhi Homeopathic Medical Association, life member of Homeopathic Medical Association of India, life member Indian Institute of Homeopathic Physicians, and life member of Indian Medical Legal and Ethics Association. And he is a faculty to several national and international conferences and recipient of many international and national awards. He is the executive editor of Rajenimbalkar Homeopathic Sandesh, and chief managing director of Homeopure and Research Institute, Vaibhav Homeopathic Pharma and Spurs Multi-Speciality Hospital. So please continue, sir.
Thank you, everybody. Thank you, KHA study group. Congratulations on your second international conference. Let me share. Can you allow the screen sharing, please?
You should able to share, Dr. Rajneesh. Please can you try once? It shows like focus. We are already focused. Maybe is there okay? There is one more. Okay. Yes, now we should.
Yeah. Can you hear me?
Yes.
Okay. Let me start because time is short. Already my time from my slot has been consumed. Therefore, I will cut off some of the screens. Today's topic is medico-legal issues in homeopathy, especially in India. I will talk about the global issues also, but especially that is dedicated to Indian medico-legal issues as pertaining to homeopathy. To explore medico-legal challenges in homeopathy, we have to learn a lot regarding medico-legal issues. We should know what is what is written inside the IPC or the Bharatiya Nyaya Sanhita of India. We should learn about the medico-legal issues also. Why understanding of the medico-legal aspects is crucial for homeopathic practitioner, I will be discussing this. Let us see the overview of homeopathy in India. National Institute of Homeopathy was established on 10th December 1975 in West Bengal in Kolkata city as an autonomous organization. It was under the Ministry of Health and Family Welfare, Government of India, and since then homeopathy is growing too fast in India as well as in whole world, but especially in India, it is growing too fast. The current status of homeopathy in India is the National Commission of Homeopathy is regulating under the Ministry of Ayush the entire education as well as the practice of homeopathy in pan-India country. As far as statistical data is concerned, that is dedicated to 22nd May 2024, there are over 3 lakhs, approximately 3 lakhs registered homeopathic doctors inside India, and we have a growth of approximately 12,000 homeopaths adding per year. That is a very wonderful growth, and we are proud of that particular homeopathy growth in India. As far as regarding the homeopathy market size worldwide in 2024 to 2028, the homeopathy product market forecast is the homeopathy product market size will be increased by billion at the rate of approximately 11% between 23 and 28. Our market research and growth report examines historical data from 18 to 22 besides analyzing the current market scenario. This is a very brilliant growth of homeopathy globally. In India, Central Council Act 1973 and Drug and Cosmetic Act 1940 are majorly governing the homeopathy practice inside India. Formerly CCH was there, Central Council of Homeopathy, but now National Commission for Homeopathy is governing the homeopathy practice inside the India. There are certain type of practices which are permitted to homeopaths, and there are certain type of practices which are prohibited to homeopaths. The permitted practices are diagnosis, treatment within the realm of homeopathy, and the prohibited practices are the surgical procedures, major surgeries, emergencies care beyond the scope. Now, I will explain the permitted procedures which can be adopted by each and every qualified homeopath in Indian continent. Homeopaths can use all the necessary measures in treating a critical patient. Whenever a patient is critical, the homeopathic physician has power to use the critical measures to save the life of that particular victim. The homeopaths are exempted from biomedical waste treatment tie-up if not running indoors. Most of the homeopathy doctors are not running indoors. The homeopaths who are not running indoor practices, they are exempted to be tied up with biomedical waste treatment facilities. There is right to give evidence in any court of law whenever needed, and which must be pertaining to homeopathy. The homeopaths can issue medical sickness certificates, medical fitness certificates, or any other certificates which are needed by the law inside India. There is right to conduct normal vaginal delivery. Most of the homeopaths do not know to conduct normal vaginal delivery, but the homeopaths can do. I will explain in further slides. These are the rulings from Central Council of Homeopathy. The duties of homeopathy practitioner to their patients. The patient must not be neglected. This is true. A practitioner of homeopathy is free to choose whom he will serve, provided he shall respond to any request for his assistance in an emergency or whenever temperate public opinion expects the service. There is act of negligence. A practitioner of homeopathy shall use any drug. This is the point. A practitioner of homeopathy shall use any drug prepared according to the rules of homeopathy and adopt other necessary measures as required. This is the schedule of homeopathy. I will repeat. A practitioner of homeopathy shall use any drug prepared according to the homeopathic principles. Okay. And he can adopt other necessary measures as required. I will explain the necessary measures. What are the necessary measures other than medicine in practicing the medical science in India? This is correction and maintenance of airways, correction and maintenance of breathing, and correction and maintenance of the circulation, fluid and electrolyte balancing, maintenance of blood pressure by IV fluids and homeopathy medicines, supplementation of oxygen and blood transfusion, and supplementation of nutrients by required route, that may be nasal, that may be IV, or that may be gastroenteral tube, etc. minor surgeries as first aid and stoppage of bleeders prior to refer to the concerned specialist, fixation of fractures prior to refer to concerned specialist, conduction of normal labor and maintaining the complicated patient prior to refer to the concerned specialist, CPR, defibrillation, shock management, and use of ventilators. These are the necessary measures which are other than medicine and medical practice. I have asked for RTI, right to information. There is right to use supplementation and routine diagnostic methods in homeopathy. This is the answer from CCH. Homeopathy Kendriya Parishad. This is in homeopaths can use glucose, saline, oxygen, etc. if they are trained in their education. Every homeopath has undergone 1 year of internship in the hospitals, and they have learned these each and everything. The use of saline, use of oxygen, use of glucose, use of ventilator, they have learned. Again, there is a government order regarding exemption of homeopaths from biomedical waste treatment tie-up. This is the answer from an RTI. The homeopaths who are not running indoor hospitals or indoor clinics, they are exempted from common biomedical waste treatment facility. And but only condition is there, they have to register themselves with Pollution Control Board only for one time. This is the one-time registration with Pollution Control Board, but there is no need for biomedical waste treatment facility. This is another example. This is another RTI. There is right to give any evidence in any court of law in India. This is the rule. Homeopath shall be entitled to sign or authenticate a medical or fitness certificate or any other certificate required by any law to the signed or authenticated by a duly qualified medical practitioner. The homeopaths can issue certificates to RTO, insurance companies, and for any type of joining of the jobs or anything. The homeopath shall be entitled to give any evidence at any inquest or any court of law as an expert under Section 45 of the Indian Evidence Act 1872 on any matter relating to homeopathy. There is right to issue any certificate required by law. This is the RTI. This is the answer in Hindi. I have already explained. There is right to conduct normal deliveries. This is again an answer from CCH towards my right to information asked. If a practitioner of homeopathy is engaged to attend to a woman during her confinement, he shall do so. This is the explanation. Refusal to do so on excuse of any other engagement shall not be considered ethical except when he is already engaged on a similar or other serious case. When a practitioner of homeopathy who has been engaged to attend on an obstetrical case is absent and another is sent for the delivery and the delivery is accomplished, the act of practitioner of homeopathy shall be entitled to his professional fee, providing he shall secure the patient's consent to withdraw on the arrival of the practitioner of homeopathy already engaged. This is self-explanatory condition. The homeopathy practitioner can do, they can conduct the normal vaginal deliveries, and for complication, they can refer to the concerned specialist further. There are certain prohibited procedures also. Most of the government officials and even the general public or patient, they think that the intravenous use of saline, supplements, blood transfusion, etc. is not the part of homeopathy, but it is not true. These can be used by homeopaths. The use of Rice tube, Polish catheter, ventilators, it is presumed not to be related to homeopathy, but these can be used by homeopaths. Minor surgical procedures like FNAC and biopsy, they can take the samples, homeopath can take the sample of like FNAC or biopsy and send for studies to the concerned pathology. Cardiac examination like ECG, TMT, these can be used by homeopathy. Echocardiography, because it needs a PCPNDT registration, which is not applicable to the homeopathy. Only ECG and TMT we can do. We can do certain pathological tests, but most of the tests are restricted. Radiological investigations we cannot do, but X-ray we can do. There are certain limitations of homeopaths. I have asked the question, can a BHMS doctor perform ultrasound scanning and pathology test along with reporting like an MBBS? The answer was no record found available in this council, hence transferred to the Medical Council of India. Medical Council of India is governing allopathic system of medicine, and it will never support the Ayush system, and he will definitely deny this question. There is again a question in treating COVID-19 patients. You can see this certificate. I have got the training to treat the COVID patients, and the certificate is by the Uttarakhand Medical Homeopathy Medicine Board, the signed by Registrar of Homeopathy. Dr. Rajneesh is trained Ayush homeopathy practitioner for novel coronavirus, preparedness, response, and containment. But when a homeopathy doctor treats the COVID patient, certain a number of questions arise from the mouths of the public and from the certificates of the government, whether a homeopath can treat COVID or not. They often consider a homeopathy doctor is not able to treat the COVID victim, but the government is supplying the certificate. Again, common medical legal issues faced by homeopaths are, first of all, misdiagnosis. Most of the homeopaths, they fail to diagnose the diseases, the conditions correctly, and sometimes they have delayed diagnosis. They make delay in making the correct diagnosis. The reasons are unqualified practice, practicing without proper education or registration, and there again next medical legal issue is faced by the homeopathic advertising violations. Most of the homeopaths try to make advertisement by their newspapers, magazines, pamphlets, or their videos on social media, etc. This is prohibited by law. I can quote a case. This is from Malda. Malda is from West Bengal. There was a doctor who was treating a sebaceous cyst of the patient, which was present on the breast of the patient, and that sebaceous cyst accidentally, very rarely it gets converted into the cancer condition. Unfortunately, that sebaceous cyst converted into carcinoma, and the patient was suffered a lot, and the patients took the shelter of the court, District Consumer Dispute Redressal Commission of the Malda. This is the case number CC 30 2018, date of filing 31st August 2018. You can see there was cystic lesion, there was sebaceous cyst on breast that progressed into a carcinoma, and court punished the doctor. The compensation of 50,000 rupees was paid, penalized to the doctor, and for the medical pain and agony. This was due to delay in diagnosis. The homeopath failed to diagnose the condition accurately. Most of these sebaceous cysts are not carcinomatous, but very rarely they can be converted into carcinoma, and there is the need of biopsy or clinical examination, very careful clinical examination, to make the correct diagnosis in proper time. This was the failure of the homeopath. There are certain legal responsibilities of homeopathic practitioners. There is standard of care. Homeopaths have duty to act within the scope of professional competence. There is legal need of record keeping. The homeopaths must keep the proper record that is needed for at least 5 years. A medical consent is also necessary. Informed consent is legally important, especially for experimental treatments. There are certain drug regulations in homeopathy, Drug and Cosmetic Act, Quality Control, Labeling, and Sale of Over-the-Counter Act. I will discuss. There are certain bonds for homeopath. A physician of homeopathy shall not act contrary to the laws regulating the practice of homeopathy. He shall not assist others to disobey the law regulating the practice of homeopathy. He shall act in aid of enforcement of sanitary laws and regulation in the interest of public health. And the homeopath must comply with provisions of Drug and Cosmetic Act, Drug and Cosmetic Rules, the Pharmacy Act, the Narcotic Drugs and Psychotropic Substances Act, the Medical Termination of Pregnancy Act, the Transplantation of Human Organ Act, the Persons with Disability, Equal Opportunity and Full Participation Act, and Biomedical Waste Management and Handling Rules, and such other related acts. I wonder, certain acts are not applicable, entirely not applicable to the homeopaths, the narcotic drug and psychotropic drug. No homeopathy is using them. Medical termination of pregnancy. Homeopathy practitioners are usually not doing MTPs. And no homeopath can transplant the human organs, but why this transplantation of human organ act is applicable to the homeopaths, I wonder. There are some certain advertising guidelines. Regulatory restrictions are there. Homeopaths must know what is allowed and what constitutes a violation. And they must not do false claims and must not do unauthorized endorsements. For advertisement, a practitioner of homeopathy is only permitted formal announcements in press and about the following matters, namely, at the time of starting the practice, he can make advertisement during the change of type of practice. He can make advertisement during change of address, during temporary absence from duty, during resumptions of practice, and during succeeding to another practice. He shall further not advertise himself directly or indirectly, price list or publicity materials or manufacturing firms or traders with whom he may be connected in any capacity, nor shall he publish cases. He will not publish operations or letters of thanks from the patients in non-professional newspapers. He can publish in professional newspapers, he can publish in medical journals, but he cannot publish his acts in routine publicity matter. Or journal provided it shall be permissible for him to publish his name in connection with a prospectus or a director's or a technical expert report, but a homeopath can publish his case histories, his achievements in medical journals only. There is importance of medical legal documentation. Proper documentation as a defense in medical cases, and types of documents including patient records, consent forms, and treatment plans. There is role of expert witness in homeopathy when needed in case of disputes or malpractice claims. And what is the qualification criteria for being considered an expert expert witness in court? The homeopathy is supposed to be expert witness in court whenever a matter is pertaining to homeopathy. This is the explanation I have already explained. This is the evidence law, Indian Evidence Act, 1872. There are legal remedies and defense strategies for practitioners. How to handle complaints and legal notices. He must know. Every homeopath must know how to handle the complaints and how to handle the legal notices, how to answer them. And he must be aware of legal complications, legal counsel, importance of consulting with medical legal experts. He must not feel shy to consult a medical legal expert or lawyer for his problems. There are certain ethical considerations, balancing ethics and law, practicing within ethical boundaries. He must practice within ethical boundaries. The domain should be under ethics. Patient-centric approach should be there, putting patient welfare for above all. Patient's welfare is the above all. He is a prior approach. Certain preventive measures, risk management, regular updates or legal requirements, continuous education is needed. Staying informed about changes in the regulation, he must read and study the changes in the regulation and rules and laws. He must be associated to a certain type of medical legal association. This is my opinion. This is not a rule. Every homeopath must join a medical legal association of repute. For example, there is Indian Medical Legal and Ethics Association. I am the national homeopathy practitioner, president of that particular association, IMLIA. This is open for all esteemed doctors, all allopaths, all Ayush doctors, as well as this is open for police personnel and lawyers also. There are certain rights of patients. We must know. There is right of patient to considerate and respectful care. Every patient has right to information on diagnosis, treatment, and medicine. Every patient has right to get information about professionals involved in the patient's care. There is right to expect that all the communication and records about them, about their cases, are treated as confidential. The patient's right is to keep their privacy concerning to their medical care program. There is right to expect prompt treatment in an emergency. There is right to refuse to participate in human experimentation or research or projects affecting their care or treatment. There is right to get copies of medical records. The patient can ask for the copies of medical records. There is right to know what hospital rules and regulations apply to them as a patient and the facilities obtainable to the patient. The patient's right is there to get details of the bill, and patient has right to seek a second opinion about their disease, treatment, sickness, and prognosis, etc. Now, final thoughts. The duration of study and syllabi by various government councils are the same for all bachelor level medical courses recognized by Government of India, like MBBS, BHMS, BAMS, BUMS, BSMS, except only one subject, that is pharmacology. In each system of medicine, the concerned pharmacology is taught. In allopathy, it is called pharmacology. In homeopathy, homeopathy pharmacy and materia medica. In Ayurveda, Dravya Gun Vigyanam and Nighantu. In Unani, this is Mualizar and so on. There is no difference in study regarding basic subjects like anatomy, physiology, biochemistry, pathology, forensic medicine and jurisprudence, social and preventive medicine, surgery, gynecology and ops, the pediatrics, radiology, orthopedics, practice of medicine, and so on, except their pharmacology as per respective streams. Only one subject is different in various medical courses, that is concerned pharmacology. All the subjects are same, the syllabus is very same. In reading MRI, in reading CT scan, in understanding PET scan, in understanding X-rays, ultrasounds, echocardiography, TMT, pathology, on numerous other diagnostic modalities or pathological tests, there is no role of different type of pharmacology. Pharmacology is not doing to diagnose any of these modalities. Only the supportive subjects are needed. I wonder why there are so many restrictions to the Ayush system of medicine in utilizing many of them. Why do PCPNDT, AERB, they have different modes with Ayush department? Why is the registered medical practitioner's definition always been restricted to the schedule of the MCI only? Whenever in PCPNDT you can see the registered medical practitioner is whom the person who is registered in the Medical Council of India Act schedule 2nd or 3rd. Why Medical Council of India only? This must be any Medical Council of India. The term should be replaced with any Medical Council of India. That may be Indian Medical Council, that may be Central Council of Homeopathy, National Medical Commission, or any other. Why Medical Council of India for allopathy only? Other medical councils register their candidates in their respective schedules, certifying that he is now a registered medical practitioner. Who can see? You can see the definition of registered medical practitioner in CCH rule. The registered medical practitioner or RMP is the candidate who is registered in the schedule this of Central Council Act. And the Medical Council of India, this right, the registered medical practitioner is the candidate who is registered in that particular schedule of the Medical Council of India Act. What is the difference? All the councils are governed under the Government of India. All the councils are equal. They are same. But the rules like PCPNDT, AERB, you cannot do ultrasound, you cannot do pathological test, you cannot be registered at Atomic Energy Regulation Board. Why? Only the RMP registered in MCI is okay, but RMP registered in other council other than MCI, he is not okay. He is not eligible. Why? Why is there is such a non-uniformity? While there is uniformity in all the syllabus and duration of the study in all the streams, all the medical stream, the rules for them should be uniform. Why they are not uniform in India? These are the references from where I have collected the data. This is not my personal data. This is collected from this Central Council Act 1993, Dragon Cosmetic Act 1940, National Commission of Homeopathy Bill 20, Advertisement Standard Council of India, ASCI guidelines, medical legal cases in homeopathy. These are the certain references from that. Risk management and legal liability in homeopathy practice, expert testimony in homeopathy legal perspectives. These are the references. There are certain case laws and judicial decisions. A review of landmark decisions involving homeopathy practice involving insight into the judicial approach to medical legal issues in homeopathy. Supreme Court of India, various cases I have consulted. Patient safety and legal aspects of homeopathy in practice, I have consulted these references. Datta, Verma, and this comprehensive guide to patient safety. Informed consent in homeopathy, a legal requirement. Rajesh G, 18. Informed consent in homeopathy practice, a legal way to go. These are the references I have consulted. This is the data collected from these various sources, and I have compiled my personal views regarding the responsibilities, foundations, limits, and their scope in homeopathy practice. And that's all. I will ask all the homeopaths, they should perform all those the doctors registered with MCI are doing. A number of tasks can be done by homeopaths also, if we are aware of that. Thank you very much.
We are very sorry for the delay, sir, due to the technical glitch. And thank you so much, Rajneesh sir, for giving such a vast knowledge about legal issues, which we homeopaths are not aware of. And this webinar will definitely help us, new as well as old homeopath practitioners, and will definitely take all the practitioner, all the precautions to avoid the legal issues. Now, thank you, sir.
Thank you very much.
Now I will invite Dr. Deepa Rajenimbalkar, PHMS, MD, PhD in pediatric homeopathy, from Jaipur, practicing in Lifetron Healthcare Homeopathy Clinic. She is a branch head and senior doctor at Qualitative Homeopathy Clinic in Indranagar. Practice as a DRDO scientist hostel homeopathic clinic in Bangalore. Author of book Panchakosha Homeopathy is a Divine Science, and her articles published in the peer-reviewed journals. And she presented seminars on homeopathic management of pediatric cases at national and international platform. Received award from the Star Time Media Most Promising Homeopathy Clinic in 2019. Received the Young Researcher Award in 2021 and 23 from the Institute of Scholars. And she is recognized as a reviewer of the international publishing platform. So, welcome, Dr. Deepa.
Yeah, thank you. Thanks a lot, Dr. Mamata. Yeah. Please allow to share the screen sharing. Please allow to share the screen, PPT.
Yes, 1 second.
Yeah.
Is it okay now? You should be able to share now, please.
Okay, yeah. Opening.
Yes, Dr. Deepa, you can speak. Okay.
I think she's back. Oh, you have Dr. Deepa, you're muted.
Yeah, it's audible, visible, all good?
Yes, all good.
Yeah. Okay. Namaste to everyone. Welcome to our second KA International Conference. So since morning, we are listening to Dr. Kavitha ma'am. She has not attended only the meditation, but she has given us the energy, homeopathy and meditation by, she has given everything, enlightened us about energy level and how the thoughts, beliefs happen. Then we have Dr. Shweta, a fantastic presentation, a very good cases. Dr. Shreepad Hegde sir presented on diabetes research methodology. And latest Dr. Rajneesh sir, this is really a very good topic. Legal issues, we really faced it for the certification and all pollution control board at ground root level, and we were really unaware about many things. So I'm very thankful to each and every speaker, volunteers, and my special thanks to delegates, and hearty welcome to our chief guest Shreepad Hegde sir for your cooperation, and sir played a role on all aspects as an organizer, as a delegate, as a chief guest. And now coming to my topic, and I'm very thankful and honored and privileged to present today. So children's healthcare needs and homeopathy. So I am also focusing mostly on India. So in India, the estimated 26 millions of children are born every year. As per census 2011, the share of children 0 to 6 years accounts 13% of total population in the country. Children are the future of any nation, and their health and well-being are paramount for overall development of a country. In India, with a significant portion of the population compromising children, addressing their healthcare needs is of utmost importance. The World Health Organization recognizes the critical health care requirement of children and emphasizes the significance of providing comprehensive healthcare services to this vulnerable demographic. So what are the specific needs, especially in India? First is nutrition and malnutrition. When I am communicating about this nutrition, so it is a population in India, in villages, we can see the lack of improper food, malnutrition. And when it comes to the metro cities, in big cities, the problem arises of junk foods, pizzas, burgers. So the nutrition, the common factor remains same. So it is the first concern, and that is also uh, for the proper growth and development, it is very important. The WHO advocates for improving maternal and child nutrition, promoting breastfeeding, and ensuring access to a balanced diet to combat malnutrition effectively. Safe water and sanitization. Nowadays, safe water we are getting everywhere. The cases of typhoid has reduced down, but still it is very important that we have to take care of these basic needs and sanitization. WHO stresses the need for improved water and sanitization infrastructure to reduce the burden of preventable illnesses and ensure a healthy living environment for children. Third point will be preventive aspect. Preventive aspects is very important. Regular health checkup, early detection of diseases, health education are crucial for children. The WHO emphasizes the need for comprehensive preventive healthcare program to identify health issues early and provide appropriate intravenous promptly. See, if we go, this goes.
Yes, Dr. Deepa, you can continue.
Yeah, I'm there, ma'am. Yeah.
Yeah.
Let's start. Deepa.
Yeah. So proper safe water, sanitization, prevention go hand in hand. It is very important to make a preventive. So for a child, every like OPD, every month, regular checkups, even for hostels and all, if a doctor is visiting, the things can be much more changeable. Other factors are primary healthcare access. When we are talking it about the health for rural health as well as in other centers also. Preventive healthcare measures such as regular health checkup, early detection of disease, and health education are crucial for children. The WHO emphasizes the need for comprehensive preventive healthcare programs to identify health issues early and provide appropriate intravenous properly. So first is sanitization, second is safe water, sanitization, third is a preventive, fourth is a primary health, fifth is a mental health support. Nowadays, it is very, very important. The competition, the jealousy, the things are going haywire. So mental health support is also very important for a child. Even two children, sibling rivalry can be seen from the early ages itself. So this point, the WHO emphasizes the need for awareness, early detection, and support services for children facing the mental health challenges, child protection and safety. Now I'm talking child protection and safety, but we can see this problem has become very high. The protection and safety issues are becoming high and high. So in children also, this kind of system, the need is very important. These policies are very important. Safe environment for a children, where your child is going to the play group, how the things are there. Your child is traveling in a bus, school, how the things are there. So protection and safety, they are having a tendency to fall down or anything. So this factor also plays. We have to protect them from injuries and accidents. And that's why they stresses protection policies and safety measures to reduce child mortality and injuries. The healthcare needs of children in India are diverse and complex. The World Health Organization recognizes the significance of addressing these needs to ensure a healthy and thriving generation. Why it's important to make this topic to come and present? So a lifetime of a good health starts in earliest stages. Early interventions and treatment. See, if we go with the early interventions, if we give homeopathic medicines to children, early interventions, the healthy child will be there. Starting treatment early can help to contain to reduce illness and to more effective. Developmental delays can be noted and address the very early interventions and treatment. Many cases, like if the treatment early stages, if it is started, the things can be very nicely done. Even if we go back for children, if the thing started with Garbha Sanskara itself, that is another topic. But the early interventions can make a much difference for upcoming area. Prevention of childhood illnesses. Preventive measures can reduce the risk of serious illnesses and reduce overall fatalities associated with childhood diseases. Homeopathic medicines. So in early interventions, we can, and even for a proper any disease, homeopathic interventions can be useful. What can be done? What they will do? Promote healthy teething in infants and young children. Treat common ailments such as respiratory infections, diarrhea associated with teething. Treat recurrent respiratory, gastrointestinal or skin infections occurring during early childhood. Promote health and reduce the frequency of infections. Manage learning disability and other behavioral problems like autism, attention deficit disorders. See, for if we are able, if we can see two children, the autism children. One child is on getting treated with homeopathy and other child is only taking other. The much more, the better child will be, the outcome with the autism children with homeopathy will be very nice. With the scale we can monitor it. So these are the benefits of using the homeopathic medicines. So nowadays I can completely understand we are the individualization part is there, but many times what happens if we visit somewhere, maybe to our relatives or any village area or anywhere, they ask us, doctor, give us a medicine. At that time we can't say ki, I will do the repertorization, give me complete case taking. For chronic cases, surely for a chronic, very severely ill cases, we can go for a complete case taking. But basic knowledge, when we talk about, when we know what are the main things for the healthcare policies, the nutrition is there, safety, mental health care, primary regular health checkup. And if we associated with this, with our homeopathic medicine, so basic knowledge of homeopathic medicines we can give. So today, small, but still you can keep this, take away. So you can prescribe them. Chamomilla used for painful dentition during childhood. It is used when child has got a hot chick and cold chick. Coffee cruda may be restlessness in teething children. Just if you saw, you give the medicine, the wonder will happen. Calcarea phos is another homeopathic remedy used for delayed and difficult teething in children. Nowadays, the parents are only coming and they are telling, doctor, we are giving Calcarea phos. Can you suggest more better medicine for this? That much awareness is there in the metro cities regarding the dentition. Colic diasporia is the common homeopathic medicine for treating colic cramps in the abdomen. Colocynth is also used to relieve cramps and pain. Magnesia phos, very nice remedy. You just give, it will relieve. Even it helps to pass the gas and pass the motion, pass the stool if child has not passed. Fever, start with the aconite and ferrum phos will surely give you a good result. Passiflora is an ideal homeopathic relaxant for a children. A child is making a very noise, not able to sleep, making the things haywire, you can give. Avena sativa used when a child cannot sleep due to restlessness. Kali phos treats restlessness in children occurring because of overstimulation. Overstimulation nowadays could be a mobile. Excess use of a mobile will lead the child will not able to sleep. He will just see the mobile. Then you can give Kali phos. Mac phos and nitram phos are other homeopathic medicines which act as relaxant. Cough and cold. After COVID, post-COVID, the cough and cold of children, the period, the duration are increased. Earlier, it might be 3 to 5 days, a 1 week phenomena. Now, the cough and cold phenomena is 10 to 15 days. So, giving homeo medicines will surely help children and relaxing for parents. Ipecac is the best remedy for constant coughing along with nausea. Aconite nephelis is used for a child wakes up from sleep with a dry hoarse cough. Spongia tosta cures cold, croup, and cough with start from a throat. Antim tart is the homeopathic medicine used when mucus accumulates in the chest, giving rise to coughing. If you give single dose of antim tart, many times a child vomit and all cough, everything is gone. After some time, the child will feel much more relaxed. And Sina for worms. Yes, if you are going somewhere, there's a बच्चों को कीड़े बहुत हो जाते हैं, किस doctor. So you can give some medicine, some homeopathic medicine in children. You can give very easily without no side effects. Only they will benefit for the children, and we can and preventive aspects can be done with the homeo medicines. So pediatric homeopathy in general practice, where, when, and why. So this was one research paper, any practitioner, even I have seen some general practitioners giving homeo medicines to the children. If a child is coming repetitive, rather than giving high dosage of antibiotic or anti-allergen, they are preferring homeopathy. So what is the main aim is to investigate the extent of homeopathic prescribing in primary care for childhood disease and assess GP attitude towards the use of homeopathy in the children. So they have done this research So they have done with, so this was the aim. Methods were done. This was assessed. Many children 0 to 16 were considered in, and computerized prescribing data were retrieved from 161 representative practices in Scotland. This study is done in Scotland. And medical attitude towards homeopathic prescribing to children were also assessed by a questionnaire survey. So why I'm telling this? So that can boost your confidence and you can prescribe very easily without any burden or pressure. Some research paper is also done on this, like how the homeopathic, pediatric homeopathy in general practice, where can be used. So I'm just sharing glimpses of it. So what this research study, they have come to the conclusion, in primary care, pediatric prescribing of homeopathic medicines most commonly occurs for self-limiting condition in infants less than 1 year of age. Although the current level of homeopathic prescribing is low, the widespread use in community suggests that at least some knowledge of main indications for homeopathy and the preparation used would be benefit to registered medical practitioners. So it could be the easily available and the medicine you can easily prescribe. So we are able to go for a preventive aspect. Even the mental health support, a good homeopathic doctor can give a good mental support, not only to the child, to the parents also. So what are the criteria given by WHO can be fulfilled at a general practitioner in every small clinic and of course to the highly qualified homeopathic physician as well. So as a homeopathic practitioner, we can recognize the importance of pediatric in context of a healthcare needs of the community and its adaptability in the practice of a homeopathy, need to identify social, economic, environmental, biological, emotional, and miasmatic therapeutic, rehabilitative, preventive, and promotive measures. Now, the time has come, we have to see the things in a very broad way, in a big way, not restricted to our clinic, our practice, our cases. We have to see it in a global way, into the India, at the India level. We should be in a very confident way, like we are able to prescribe a medicine in very easily way. So with that, many research is already done. You should identify, like you should know it. The researches are done, what I am prescribing. You should have some basic knowledge of a medicine. So that will give you a confidence and that will reduce the preventive aspects will be reduced. Empathy and human approach towards children and their family and exhibit interpersonal behavior in accordance with the social norms and expectations. Implementation of national health programs effectively and responsibly help to reduce child mortality and morbidity, to improve nutrition status, growth, and early childhood development. The status of homeopathy in the world is evident from the WHO report, which reveals that homeopathy is one of the most common forms of traditional and complementary medicine used by member states of WHO. With efforts of Government of India, there is a remarkable growth and development of homeopathy and other traditional system of medicine, including Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Sovaripa, acronym as Ayush. Services are now recognized as a part of healthcare system of the country at all levels of primary, secondary, and tertiary healthcare. So main aim, every child at all this level, the homeopathic medicine should reach to each and every child. Case studies. So a newborn child brought to clinic before taking child to their home. This was a case from my own OPD. So the patient got discharged from the maternity. So before going to home, they brought a small, just a 2-3-old baby to the clinic. And at that time, during pregnancy, mother was suffering with cold and allergies. So we go for no medication. We said, you try to bear with it. You try to take good rest. You try to take a proper steam inhalation. And now this baby is, they brought the clinic, doctor, you see just this baby. So just I gave a single drop. I gave a drop not a globule. I gave a drop of arsenic album 200 to this newborn baby, just 2-3-year-old. Her first child was taking my homeo treatment. That was very well. That child was doing well. And now this small baby, now that baby is some 3-4 years old, no allergy. Absolutely, they are living in Bangalore, allergic city they are living, but this small baby, and they are so thankful, doctor, we brought the child, that one drop of your medicine has helped our child. So you can see how much wonder we can do our medicine. Early intervention. What we have done the early intervention to this child. Even one more case, like for mental support, a child got a fever. Child got a very high fever and not improving, antibiotics, even homeo medicines, individual case taking, everything was done, but the child was not improving. So what was the problem? The problem was the child was scolded by a teacher, and she got stuck with that, some insult. So that case improved with a staphylococcus. So mental health, a homeopath can give a very good support. So when I was studying WHO, the policies and these points, I said such a correlation, such a nice correlation with whatever the main things they are talking and what things a homeopath best can do. So these are the cases and some rubrics I want to share with you. For nutrition and malnutrition, these rubrics are available. Children abdomen general enlarged emaciation with children anorexia nervosa, children development delayed arrest, nutritional disturbance. See, this rubric can be used in metro cities also and in poor family kid also, like because the work culture over metro cities are, both parents are working and they are not able to get good care, basic nutrition care itself. So this rubric can be used everywhere. Nutritional problems, nutritional disturbances, nutritional problems, diseases, marasmus, abdomen large, so belching, sore, bottle feed babies, common again. Bottle feed, only one remedy, nitrum phos is there. Buttocks emaciated, children buttock emaciated, insipid, irritability, child will be approached by no one. This is your observation, you made an observation and you can prescribe. Jerking, hiccup, nursing, belching without bringing up of food. So these are the rubrics. So dear friends, I think my purpose of children's healthcare needs and homeopathy is solved. And once again, thanks a lot to each and everyone for attending this international conference, and best wishes to Dr. Mamata and Dr. Deepika for your presentation. Yeah. I'm done, Dr. Shweta. Yeah.
Thank you, Dr. Deepa. That was very informative and wonderful session on children's health care needs and homeopathy. And now we would like to invite Dr. Mamata to speak about clinical spectrum and role of constitution in treatment of PCOS. Dr. Mamata Kumar, PHMS Pune University, ICR trained. She is member and resource person of ML Vale Memorial Homeopathic Institute of Bangalore branch. And she is a consulting physician in CHS MLDH-MI Trust, contributing articles to NJH, practicing in Bangalore since 2005. Let us welcome Dr. Mamata.
Thank you so much, Dr. Kavitha ma'am. I am honored to be introduced by her. Now, already it is too late, so I am just starting my topic. So, dear all, my topic going to be Hello. I'm audible? Can everyone hear?
Yes.
You can hear that, right?
Good, ma'am. All good. Yeah.
Very good. Thank you so much. I am very honored getting introduced by Dr. Kavitha ma'am. So I'm starting my topic now. So dear all, my topic going to be sharing with you as a PCOD and PCOS. These two very important conditions came to us as a homeopath very frequently, and I'm also going to share with you remedial measures which I practice mostly in my clinic, and mostly I use the chronic remedy and as well as non-remedial measures. So this treatment plan which is going to be used by you as a homeopath is totally dependent how we understand the diagnosis of PCOS, and which is my topic. And also I want to include PCOD because this is also very commonly condition arriving in our clinic. So let me begin explaining to you what is a PCOD and what is PCOS. So and its implication in our management. So it is important to understand what is PCOD and PCOD occurrences and PCOS as of today. So it is affecting 10 to 20% of population, and it is grown by almost 5 to 10% in last 6 years. And you will be surprised to know that in US it is almost touching 47% and in my clinic majority of conditions that come to me is 1 in 10 cases of PCOD and 1 in 20 cases of PCOS. So PCOS is a condition which is little deeper and it is genetically inherent condition. It also has other causes of like a mental stress and lifestyle, and primarily it is a androgenic hormones that are increasing. As a result, the obesity develops, which is very difficult to manage and not easy to control the hair growth which they get, and very difficult and getting very difficulty in conceiving. So there are many more complications of PCOS. Hence, homeopath we have to give the multi-pronged approach, which uses many kinds of remedial forces. So not just the chronic remedy, which I will share with you a case that will demonstrate how to manage the PCOS. And on the other hand, the PCOD is a very simple estrogen progesterone imbalance that does not allow the follicles to rupture the eggs, and it results into the delayed cycle and irregular cycles, and that obesity comparatively is easy to manage with the non-remedial measures, and this condition can be treated with the chronic remedies. Again, I will share with you a case and which will explain how to manage PCOD. So what is a PNA axis and how does it affect PCOD and PCOS, and why it is important to us as a homeopath. So case 1 is a story of stress burning my system, and the case that is of PCOD, and case 2 is the case of PCOS, story of shadow cells, that is a PCOS case. So let me begin with explaining to you a case of girl, that is a PCOD case, a 16 years of age who comes with a ready diagnosis of PCOD. She writes a history that she is under the tremendous stress with coping with her IIT classes and as well as her school, because she is in the 12th grade. Earlier, since 4 years, she used to miss a period during her throughout the 1 year, like once a year, and since 1 year it is very irregular and delayed. So she had to take the medicines for getting the periods. And after the gynecological evaluation and the scan, it came in as a diagnosed as a PCOD, and she's looking very sad and depressed and anxious. So here it is really important to us to understand what is the implications of the diagnosis and what are the complaint patient is presenting and why patient is suffering. So to understand the diagram of PNA axis, we need to know why this axis is important to us as a homeopath and who coined this axis. So this is coined by Professor Walter Cannon, who is a professor of physiology in Harvard. University, and he explains every stress the individual goes through at the level of mind, which we call as a psychosomatic illnesses. It is going to affect the neurons, and that is the neurology, and it is going to affect the endocrine system. So he termed it as a psychoneuroendocrine axis, and which affects the hypothalamus, pituitary, and ovarian axis, and it has a direct implication how your uterus is going to behave. So Miss D, 16 years of age, comes from a home that was very pampered and protected and attached to everyone in the family, but especially her brother. Up to the 8th grade, she was doing very well. She used to come within top 10 of her class. She had many friends. She used to like to go out with them. And she was performing dance, classical as well, non-classical form. Everything changed after her 8th grade. So let us understand the evolution of the person and the stresses of that patient is affecting the PLD axis and HPO axis. So the patient comes from a very attached family and protected family, very backward child, but was very anxious personality. Anxiety used to come before exams, and she used to get sleepless night and the palpitations and the fear. So when she started IIT classes in 8th grade, her anxiety increased by leaps and bounds. So she was not able to score in the school, and her ranking was started dropping. And that sore was the attachment her was her big brother, because he was busy in his IIT classes when she was in 8th grade. And it was and after since 1 year he went to IIT, and this is the breaking point for her. So it affected her PLD axis, and now the system not able to cope up with her stress of coaching classes as well as her performance in the school. So she developed so much anxiety before the exams, and irritability and the quarrel self-names with her mother. So it is very important to understand other physical data along with her core, that her desire, aversions, aggravations before menses, during menses, her disturbed sleep before exams, dreams of anxious dreams, and profuse perspiration on the slight exertion, and cheeky, and the past history of profuse menses with the dark red and clotted, and she has a family history of psychotic diabetes and hypothyroid, and her attributes already we discussed, that attached and anxious, and anxious about her performances, and irritable with quarrelsomeness, and fearful and immediate precipitating element from its intense anxiety about the performance and anticipatory anxiety, how she cope up with her both demanding pressures. So this is a chronic totality I put up, which I shared with you. And this is the repetition done based on the chronic totality. So I would like you to respond what remedy is coming to your mind. So I share because it's already late. So most of you come to the right remedy. So let's differentiate between the core of few remedies that you have listed. So Kali, Calcarea, and Sepia. So let's begin with the understanding of Calcarea. The Calcarea patient is very secure and protected environment, just like our patient, and very hardworking, but always aware of the resources, and where not extend beyond this to stretch herself to do the things like IIT. And she has a timidity which she will not take a risk of quarrel with her family members. The second is the Sepia. The Sepia is ambitious, hardworking, and always keep her work ahead of her relationship, which drives her to inherent need to keep performing, and not due to attachment, but more due to the responsibility and duty. And what makes her happy, that which is not in our patient, due to the actually she is not doing all these things with the quality of beauty being. So this patient is more suitable. I think Kalika is more suitable because it drives all her actions from the attachment with her brother and with her anxious personality, which intensifies her anxiety and the stress with irritability quality and quarrelsomeness with her mother, and extreme sensitivity, which we always find in Kalika. And along with that, her physical generals are also suiting. That her sleep, craving aversions, her type of menses, and ailments from anxiety, missing of her brother after he went through IIT, and that is affecting her PNA axis. So after giving Kalika 200 single dose, she immediately got her periods within 3 days, and she continued. I continued giving Kalika 200 single dose weekly till the period get regularizes. And also on the back of my mind, I wanted to see the scan report comes from. So hence I did not stop the weekly doses. And after 3 months, patient herself made a conscious decision withdraw from her IIT classes, and this is when I told her to concentrate on her diet and rejoin the classes of dance which she used to enjoy. And she immediately agreed also, because giving Kalika made her already internal bleeding, and after 8 months when the exam was near, I made a conscious decision to raise the potency Kalika for them, because she decided that time she wanted to join the CET classes and to get admission in the local engineering college. And also in my mind that I wanted to repeat the scan after a year to get the report normal. That maybe this is my anxiety. So what happened after this? The diet, exercise, social interaction, and all the balance resources happened to increase. And it is important to not always change the diet. We tell them not to only we tell them not to indulge the high carb diet and the fatty diet. Pay attention to healthy diet. So when internally healing happens, the patient sets right all the imbalances. So the report clearly visible to us the magic of syndrome of chronic remedy. So there is a no cyst visible after 1 year of scanning. So why in the Amorism 2030? So our master says why it is important to know the disposition and the chronic constitutional totalities. Every disease condition will not select for the patient's relief. In addition to those symptoms which match the disease state, we also need to see whether it is capable of producing the singular state of disposition and the mind. Then only we can cure conformity to nature, that is a homeopathy. So what is a take home learning? So take home learning is the chronic illnesses. PCOD is a chronic illness and it has a multifactorial condition. So what I started earlier, that it is mostly related to estrogen production of imbalance that do not rupture the eggs, and it has a multifactorial condition. The mostly the immediate stress, poor lifestyle, and that needs to be managed, and the chronic case approach, and receiving the patient sensitively and treating her sensitively and holistically using chronic remedy that covers the mind, body, and pathology. The working on the non-remedial measures like diet and exercise and distressing patient will ensure the cure takes place faster in the conditions. So now let me share with you the second topic of my presentation, that is the PCOS. And this is a case of 32 years old lady who is married since 4 years, and husband is a CEO of another company, and she is a director of company. And they made a conscious decision that they don't want the children, and they want to focus on their respective careers. And she is very hardworking, very ambitious, and very successful. And she maintains the distance between her colleagues and not much socializes. She believes she does not cross the compartment barrier between her colleagues and friends. So a lot of work in the company done by herself, and she ensures it's a part of everything. And now what is she come down with? So last 2 years she is getting delayed and irregular periods. And what is an irregular means? She used to get once in 2 months, once in 3 months, sometimes once in 45 days, sometimes once in 20 days or so. But used to get lasting longer. And she was getting weakness along with the irregular periods, and she has a lot of weight gain, some 45 to 60 kg increased prolactin levels, and there is a insulin resistance that gradually develop into the diabetes, but not a frank diabetes. Her thyroid level was quite normal, but her androgen level was going up. And Gynex suspected the PCOS based on the pattern of her hair growth on her chin and all over the body. And there was a genetic history also that her mother and her elder sister had a difficulty in conception, and they were suffering from the PCOS. And the third point was her FSH ratio was also over as 50, and Gynex did the ultrasound that was confirming the PCOS. So let us understand the PCOS through this diagrammatic representation. So how the stress is one of the part of genetic predisposition, and more important affects the hypothalamus, that affects the pituitary, and then androgenic hormones are released, and that directly impacts on many areas like resistant weight gain and the hair distribution like hirsutism, and causes the higher chances of infertility and delayed irregular cycles. Basically, you are developing the male masculine features. So, homeopathically, it is very important to us to understand how that lady is from the childhood. So, now from the childhood, can we see the male speaking? Why this lady is so focused on the hard work, and was born in a family as her mother was a very undemonstrative and father was very mild, very busy. He could hardly spend time with her, and strict upbringing, focus on the studies, and she felt forsaken. And why she felt like that? Because she wanted to channelize her forsaken feeling into the work, studies and sports and peer leadership like that. And she was very devoid of the emotions and happy to be herself, and very rarely socializing, and very successful and intelligent. She became ambitious, sensitive to criticism, aggression, and consolation, and she was getting evaluation when she was reading her work, and she started developing the anxiety about herself and the fear of poverty because it was very important to her to earn the money. So along with that chronic totality, always use the physical data like desire averages, harassment, depression, sleep, nausea while riding, and irritability before the irritability before the menses, and her physical structure, the upper half of the body was quite obese comparatively to the small lower one, and her genetic family history of her mother and her elder sister that having the PCOS, and the psychotic features of long-standing hypertension and diabetes and heart disease in the family, and which I explained the her disposition as an element from forsaken feeling, hardworking, sensitive to criticism, desires to be alone, fear of poverty, better when she is busy, anxiety, health about, and aggravation to consolation, and aversion to passion. So this is a journey. So a psychiatrist who spoke about the electron complex. What is here that females naturally gravitate to father, which we know. However, they balance it out with the innate feminine need to nurture. The female energy will suppress and be part her inner shadow self if she gravitates very strongly to the male energy and represses her female side if they grow up in the environment like our patient, where the maternal and love and the touch is lacking. So homeopathic remedies help to release this inner energy fields and balance the energy fields and keep the patient aware of this side of herself which she has longly suppressed and not aware of. That is a feminine energy. So that totality is formed, which I shared, and that represented in the representation table. So here the remedies came, like that I think most of you think of sepia, that is right. But let us understand the other remedies also, that from the core of second feeling, how they evolved, because that is how the patient evolved, and made her the most masculine part so come out so strongly and replace the female energy that in lack can, which is a strong remedy for the PCOS, as well as the infertility and the periods problem, and very good female development. But that can grow into the 4-second feeling and grow to very poor self-esteem, low confidence, and trying to compensate by over nurturing, and very irritable, and quarrelsome with the people who don't reciprocate to her love and affection. So in magnesium proof that it grows within the organ, makes them feel like a magnet and want to be get attached with everyone who reciprocate with them. And there is a vacuum along, there is a irritability, quarrelsomeness, and there is the extreme anxiety that is replaced in their dreams. And the characteristic they have the characteristic specific powers. Then coming to the remedy which we have chosen is a sapia. It is a solitary cuttlefish that lives in by herself and constantly moving. Even abandons its own eggs after laying off, and silently rebelling the suppressing like nitram, and 4-second it is being channelized to herself, that is to the word through her word, and totally divide also the emotions. She is able to perform as well as she is ambitious, hardworking, and always emerges as a woman figure, which I showed in the last slide. So that completely replacing her feminine energy, and she does all the things like a duty and responsibility without the warmth. And it is very good for the female genital organs with the characteristics like the riding aggravation, before menses, and the chelipation. So follow-up is a very interesting that I had given 3 doses of sapia to portray, and I believe that we need to stimulate the ovaries until the patient her entire biliary HPO axis settles down and the hormonal axis comes back to normal. So there should be the normal follicles present. So we started with the 3 doses of sapia and continued up to 5-6 months, and then repeated the hormonal test. But what is important here, like her insulin resistance was not coming down, and her androgen levels were marginally coming down, but not very. And periods were coming regularly. And even though mentally and physically she was better, and her sleep and aggravation before menses were not coming down so much, she was gradually losing her 1 kg weight and coming down, and her hair fall was much better, but her insulin resistance and androgen were significantly not coming down. So I introduced antipsychotic pyramidine Suja, a single dose 200, continued with the sapia. We repeated Suja once a month for 3-4 months and repeated the test afterwards. Her weight came coming down very quickly after Suja and losing 1 kg per week like that, and everything turns almost normal, and excessive hair growth also came under control. The patient was kept on placebo till she missed the period. In August, she missed for 45 days, and I thought I could take a chance and do the pregnancy test, and that turned out to be positive actually. And the patient was very happy. She said, your internal healing was happened. She said, I really want to spend some time and in the pregnancy and have a baby, because I don't want to do the work. I want to balance the work and the home. So this is the power of syndrome, that we internally the repressed side of the feminine energy, which I was talking according to Tarjan theory. As I want to share with you, as you have a knowledge skills for the homeopathic physician, when to order the investigations, ultrasound, hormonal excess. It is the slide to show you that. So what is the technical journey? As a clinically, there is a no single test, as you have to correlate with symptomatology. That patient is presenting and do the testing of FSH, LH. You will find the raised testosterone, increased prolactin, fasting, insulin, and scanning shows the string of pearl appearance, that is called as the oyster ovaries. So what is the technical journey for as in PCOS? It is the affection of psychohuman axis, genetic inheritance, and the stress makes impact on the genetic predisposition. Homeopathy has the best integrated remedies, chronic preventive remedies to cover the predisposition, exposition, and to the exposure to completely bring about the internal healing and ease the symptoms. So homeopathy and homeopaths also pay attention to district mental health to bring the healing, and chronic impacting remedies usually help these cases. Also, like introduce the mathematic remedies like the puja and some sarcos like pituitary, ucorinum, and even testosterone hormones if we are not able to manage the investigative findings. And the phase restrictions like sabina, amylase, to manage the bleeding, and centesimal scale depending on the characteristics. We can go frequent doses after finding changes. We can make it taper it off and go to infrequent doses. So we'll also find after we find the changes through investigation and the scanning. So I want to say thank you to dear Kavitha ma'am for this opportunity given to share my clinical experience, to Hegde sir for guidance and support, to MHI Bangalore faculty of Bombay, Dr. Dr. Ramdas sir, to my family, to my patients who are the best teachers, and thank you all for patience. Thank you. Thank you, Dr. Mamata, for very detailed and wonderful description about more insights on PCOS and PCOS. It's really enlightening. Thank you. Thank you, ma'am, for appreciating me. Now I will introduce Dr. Deepika Balani. I invite her to come forward. So, Dr. Deepa Balani is a national and international speaker. She is a 6 times recipient of national level and had received awards for research and clinical work and the charitable services. She is a volunteer of CAR Study Group Pro Bono, USA. She is an executive member, student coordinator of Delhi Homeopathic Medical Association. She is a member CP division of SIM SOG. Has also served as a president of Central Zone, program coordinator, and joint secretary in Bharatiya Chikitsa Association, Delhi. Please take your.
Thank you so much, ma'am, for such a beautiful introduction. Good afternoon to everyone. I hope my screen is visible.
Yes, we can hear you also.
That's fine. So today we'll be talking about a homeopathic approach to cancer pains and palliative aspects of cancer. First of all, I wanted to present so much gratitude for this opportunity to be a part of this esteemed conference, and especially to Kavitha ma'am and Ka family and my mentors as well. So on a brief overview, we'll be discussing about the introductory aspects, the meaning of each and every concept, and how homeopathy is applicable with a few examples as well. We'll also touch upon some latest researches that are available on this topic. This is just a small disclaimer. So, cancer being such a deadly and disabling disease, and it has not been offering so much support and great treatment modalities which can claim to get rid of this disease. So with the current rules and regulation, we can approach the patients through integrative care. And through this presentation, we'll explore how we can improve patients' quality of life, or what benefits or what methodologies we can adapt to handle the patient's symptoms more effectively. So what do we mean by palliative care? Palliative care is where the disease is on a very advanced stage, and our main focus in this case will be pain relief, symptom management, and improving the quality of life. And through homeopathy, we can offer complementary approaches and we can reduce the patient's pain and discomfort. So what happens is, like, the most prominent and the most disabling symptom of cancer is the cancer pain, and which arises due to invasive nature of the tumor and the side effects of the available treatment that is there. The pain can be classified into acute, chronic, and breakthrough pains. Acute is of a shorter time duration, chronic is of a longer time duration, and breakthrough pains are those pains which occur in spite of the pain relief medications the person is taking. And the challenges we face in the management are there are very limited options available, and we also see the opioid dependency, because most painkillers are of which deal with that severity are of opioid nature, and they have the dependency and side effects as a collateral available. So through palliative care, we are going to provide relief in the major and disabling symptoms, and in turn this will relieve the suffering of the patient, as well as will be addressing the families as well, because when they see their family members suffering, that is the most painful thing, to be not able to do something for them in such a painful situation. So with the patient, we also tend to relieve the families who are involved with the patients of cancer. There are a few basic principles that run across even in the palliative care. That is the highest idol of cure that's available in aphorism 2. We are going to offer the best possible treatment in the most harmless possible way. Similarly, with the knowledge of disease, medicinal powers, obstacles, dosage, and all the basic homeopathic principles, we can provide relief to the patient. If we are able to gauge how severe the patient is and what kind of help we can provide, then we can reduce the suffering of the patient. And the proper history taking with all the important elements is also applicable in the palliative care. And if at all the patient is not in that state to give you the history, then probably observation is the way to go. Then we are also going to touch upon the aphorisms that discuss the chronic diseases, because cancer is a disease which has a long incubation period, or probably we can say there's a long insidious progress which is not easily noticeable, and it's a very late diagnosis usually. And we have to be free from our biases, as mentioned by Dr. Hahnemann in aphorism 83. And if we are treating that case, we need to be aware of the specific remedy for that particular case through proper history taking. In aphorism 80, the word cancer is mentioned by Dr. Hahnemann. And in aphorism 246 footnote, which says that a mixture of allopathic and homeopathic medicine processes is not that better. And we do not provide larger doses as available in the contemporary field. We just provide dosages as per our principles. There are many other places where the word cancer is mentioned in aphorism. For example, aphorism 205. And even in the 6th edition, they have mentioned. So sorry. Even in the chronic diseases, it's mentioned, where the bone cancer is mentioned. And in various philosophy books, it's mentioned as a multi-miasmatic diseases, primarily psychotic or tubercular in origin. There are various studies available. I'm so sorry. There are various studies available. Even RCTs are available nowadays, which shows the evidence that the cancer pain can be reduced and the quality of life of the patients can be improved. Even we have seen that how homeopathy has been helping in the side effects of the treatment, as mentioned in study number 3. And also there are patient reported outcome studies available which show that their quality of life, emotional and psychological well-being are being improved as a adjuvant when homeopathy is taken. These are not my cases. These are cases available in various research papers. I've just taken 2 important cases where there has been relief seen in the cases of breast cancer and lung cancer, where there was a history of pain, where hypericum and arsenicum album in the given potencies were given, and there was a pain reduction seen, and there was improvement in the mental health and sleep quality as well. This is a very major point that homeopathy is offering, because this is the most painful and the disabling part of cancer. Now we are going to go through some common remedies of cancer. First is sedum acre and sedum repens. These are usually given for the fissures and hemorrhages that occur in cancer. Scrofularia nodosa is indicated when there is glandular invasion. Sempervium tectorum is given for ulcerations. Condurango is given when there is ulcerations on the labial commissure. Cistus canadensis is given for those conditions that arise around the neck. Hydrastis is given for hypochlorhydria where there is digestive difficulties. Creosotum where the ulcer is bleeding dirty. Those typical creosotum features are available and seen in the ulcerations. Ornithogallum is given where there is pyloroduodenal sphere involvement. There is an obstruction or when it is associated with vomiting that is of coffee ground in origin, that is the upper GI bleed is seen. Phytolacca is given for heart tumors, especially of mammary and axillary gland origin. Common cancer pain remedies that we should keep in mind are arsenic, apis, arnica, brynia, calcarea acetica, euphorbinum, magphos, and ruta graveolens. A few rare cancer remedies with their indications are mentioned as follows. When hemorrhage is seen, huangnan and cinnamonum can be given. Just a second. I'm so sorry for the throat today. Then for the bad effects of radiation, we can give radium bromide and X-ray. For ulcerations, we can give fuligoligni followed by creosotum. For pain, we can give cosin. For induration, anathirum. And for those cases where there is liver cancer or there's liver involvement, gallstones are found as concomitants, then we can think of choline and cholestyrinum. For diuretics and cases where the kidney involvement is there, we can give gallium apparent. There are a few specific nosodes we can also give in cancer, such as tuberculinum, medorinum, syphilinum, and all that is given as a base with anti-miasmatic predispositions and dominant miasm we have to consider for these remedies. When there is a strong history of cancer in the family, then carcinosin can be thought of. Even bowel nosodes can be thought of in cancers. And when there is a carcinomatous type of tumor, then we can give Bacillus morgan and Dizentricus. And if there is a sarcomatous type of tumor, then we can give Bacillus morgan and Bacillus Gartner. There is a new concept running nowadays by the name of anthroposophical remedy. It is an alternative medicine, and it has a philosophical background behind it. And the most common remedy is viscum alum, with the indications as mentioned. The advantages of giving homeopathy is its holistic approach and minimal side effects. But the only thing we should be concerned about is that we need more large number of double-blind trials, and there is a very limited acceptance of our pathy in mainstream oncology. Whereas there are a lot of ethical issues involved when a cancer patient is being dealt with, and the collaborations gained are very difficult. So if we happen to get a chance to research further, then we should mainly focus on how homeopathy can improve and enter the mainstream by providing relief to the patient. And also we need to educate homeopaths about oncology a little in more detail, and we can develop some guidelines for safe integration of homeopathy in palliative care and as an adjuvant to start with. So we discussed today about homeopathy as a valuable adjunct in palliative care, and we emphasized on the fact that it provides holistic care and patient-specific treatment. And the main thing that we are lacking on our part is the research. These were the following references I used. For example, WHO, our classical Organon and Materia Medica books, and various other researches that were used. These are all quoted here. Thank you so much. And I am really thankful to Kavitha ma'am again and my Ka family, who was so supportive in giving me this opportunity to present the seminar today. And just in case, if there are any doubts, you can feel free to contact me, or just in case you want to participate in any workshops that I run, please contact me as well. Thank you so much.
Can everyone hear?
Yes, ma'am.
Okay. So, and we have Dr. Rajneesh Kumar's books. Please try to, whoever are online, they can order online. And the ones who are here, there are several books there at the desk. You can purchase. Homeopathy, the medical legal perspective, and from heartbeats to brain waves, and homeopathic therapeutics in universal medical terminology, and exposition on efficacy of homeopathy in sarcoidosis and miasmatic concepts. It is on neocortex and its functions, and a textbook of galactoria, fingerprints, and beyond the gut, and many more books are there. Thank you all, and we thank today's sponsors, Kevin Friendly Foundation, R2C, and Homeopathy Research. And we would like to felicitate Dr. Shweta. You are there? She is also there. Okay, so first we would like to felicitate our chief guest, Dr. Shreepad Hegde, for coming over here from far and sharing his knowledge and wisdom and on this scientific session, Anaemia, and it was really wonderful and special in his divine place. Thank you so much, sir. Thank you. That blade is coming like this, right? Is that the picture is coming good, right?
Yeah. But the glare is coming.
Blade is coming. Yeah, we are not able to see.
Yeah, not able to.
Yeah. Can we see here? అది షైన్ వస్తుందమ్మా గ్లేర్ వస్తుంది Yeah, it is focusing on the light is focusing. वो लाइट आ रहा है ज्यादा. Can we do here? तो वो कम कर सकते हैं क्या? Fix it. Okay. फिर उधर चला जाएगा. It's okay. That's it fine.
హనుమాన్ ఫోటో ఈ సైడ్
Yeah, I think now we can see, right? Yes. I think this is much better.
अब थोड़ा पीछे.
Everyone unmute. I hope everyone online Zoom. Yeah. You can also. Yes. And who is taking? You can also come. He will be there. Please come. Yeah, please. Come. Yeah, everyone on Zoom can unmute now.
We are there, ma'am. Yeah, we are with you.
Oh, thank you. Thank you so much. And we would like to honor Dr. Mamata. We want to take honor Dr. For her contribution as the honorable speaker in today's conference. Yes, yes. Thank you, Mamata. Thank you. And we would like to honor Dr. Shweta Singh, our Chief Administrator. And since she is not here, we are honoring with her momentum. Dr. Shweta, you are there. Please show your momentum.
Thank you so much, ma'am.
Everyone unmute. It's okay. Did you show the paper? We haven't seen.
Thank you.
Yeah.
Is it visible?
Screen is not coming. 1 second. Yes. Yeah. That's a beautiful. Thank you so much.
Thank you so much, ma'am, for this opportunity. Thank you.
Thank you, dear. And for being our honorable speaker. Thank you so much. And next we would honor Dr. Deepa Rajenimbalkar. Yeah, here, Dr. Deepa, we have here.
Yes, ma'am.
Beautiful. Can you see?
Yes, ma'am. Thank you, ma'am. Yes, ma'am. See, I can see now. Thank you very much, ma'am. Gratitude, lots of gratitude.
Congratulations to you. Congratulations to all our honorable speakers. And yeah, next we would honor Dr. Rajneesh Kumar Sharma, and he has his memento. Dr. Rajneesh, would you like to share, please?
Right
Congratulations.
now, I am having this memento. So this is for you, Dr. Rajneesh sir.
Okay, can you share Dr.
Yes,
Shweta
ma'am.
Singh? Yeah, thank you so much. For all, we appreciate Dr. Rajneesh for all his contributions. He's doing amazing job. Okay. Is Dr. Rajneesh there? He's muted. Okay. Yeah. Yes, and everyone's patience for being late at the lunchtime. And we would like to honor Dr. Deepika Balani for being our honorable speaker. And so, Dr. Deepika, would you like to share? Congratulations, dear.
Thank you so much, ma'am.
You want to share your memento?
Ma'am, it's not with me today.
Oh, okay. I think it is on the way, I think. Okay. No worries. Thank you. And did we cover everyone, Dr. Mamata? Yeah. Dr. Shweta, did we cover? Yes. Okay. Now, Shweta Mamata. Did you? He's playing. Today it's our privilege to honor Dr. Kavitha ma'am for her boundless and enthusiasm for promoting homeopathy and providing the continuing education opportunities to students and practitioners, which is admirable. We wish her the very best. Very best for her pro bono work with Ka. And we are delighted that she is doing this unique and selfless seva for homeopathy. May her vital force keep her shining energetically. So,
Ghost बनाना
Dr. Shweta, you want to say anything?
Yes, sometimes words are not enough for someone you admire the most, and that is what is happening today with me. To be honest, never before have I seen a lady like Dr. Kavitha Kukunoor, who is so dynamic. Am I audible? Am I audible?
Yes, Dr.
Okay. So to be honest, never before have I seen a lady like Dr. Kavitha Kukunoor, who is so dynamic, dedicated, hardworking, and yet still tenacious at the same time. She always manages to distinguish her work by having it done so well and putting her heart in it, which I genuinely appreciate. And she's such a beautiful soul with a golden heart, and so lively, loving, caring, and extraordinarily kind. I always left astounded at the level of efforts she put in to make everyone happy. I'm honored that I got this opportunity to be associated with her through this CAR platform, which she created to promote homeopathy and the homeopathic mentors and to inspire the budding homeopaths so that they shine worldwide. Ka Homeopathy Study Group is one of the most motivating place just because of her. And it is an absolute pleasure for me to work and learn under her guidance. I feel fortunate to have an amazing mentor like her. The way she praises, the way she motivates, and the way she supports, the way she loves is something that helps establish a sense of confidence as well as a zeal to work harder. So she is really an inspiration to all and deserve all the applause as well as my sincere gratitude for all the selfless work she is doing. And we had this pleasure to felicitate her with the Lifetime of Achievement Award today. So many congratulations to you, ma'am.
Thank you so much, Dr. Shweta and entire Homeopathy study group team. I'm so honored and privileged. I am so humbled and share all my gratitude, all my success to my college, to entire Homeopathy study group team, mentors, teachers, and I give this to God. That way He can make me more humble and do much more. I'm sending lots of love to you and entire Homeopathy study group team, Dr. Richa, Dr. Mamata. Each one, there are 15 people are there. If I miss anything, Niharika, Dr. Shramana, and everyone, Dr. Deepika, Dr. Deepa, everyone, so many are there who have worked so hard to make this event so great, successful. And Dr. Shweta Singh, as a car chief administrator, she handles all these activities in such a way that everything goes so smooth. And every year we are enjoying. It's like, and today we got this opportunity to do at Pyramid Valley. That is really amazing. And sending all the blessings to everyone and wishing my team and our study group to grow further beyond the limits and reach the heights. Thank you all.
Morning, Kavitha. I'm very happy to inform you this. I'm very proud of the species organizing this type of organization. So, you are enlightening the sciences of homeopathy to the practitioners, patients, as well as the lovers of homeopathy. So, in this regard, I'm very proud of you. I bless you.
Dr. Kavitha became known to the homeopathic community when she began her work on the board of the Homeopathy World Community, an organization founded by Debbie. When Debbie passed away, Kavitha tended to the organization as if she had started it herself. Later, as Gonzalez Sperling puts it, her creative energy had to find a way to be expressed in her own venue. So Kavitha founded the Kavitha Holistic Approach, a pro bono study group open to the world community by way of newsletters and webinars that are offered for free. I, like many homeopathic educators, have been invited to speak on her platform, and I was stunned to see the numbers as I was speaking, as it reached over 400 attendees. So she clearly has a following. From what I hear, Kavitha works countless hours each day, and in Gonzalez's words, we can feel a sense of relief and joy to realize that people like Dr. Kavitha Kukunoor are amongst us, tirelessly promoting homeopathy, day in and day out. And they will do that.
So, very happy to see you certificate. It's a good privilege to the homeopaths or any homeopaths in the sense to protect homeopathy or promote homeopathy.
There is no limit beyond limit. And small lines he writes below that. What is that line? I will read for you. The challenge
So, once, unless and until we face the challenge, Swami was also telling the first word that unless and until we face the challenge, there has to be some difficulty. Therefore, our Kavitha is wonderful. Therefore, this Kavitha is very happy. Therefore, Kavitha is facing challenges and she is ready to face whatever the challenge comes, will be successful. The reason for her success is that she is accepting the challenges. With this, I wish her all the best in her life. Thank you.
She supports the charity organization of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. The study group celebrated stage 4 cancer survivors by providing moral support, offering them space to share their dramatic and encouraging stories through a series titled Inspirational Book Talks. Kavitha's pro bono experience with the study group and her outreach with other organizations has also been a most awesome personal reward. She leads a team of 15 to 25 people in such a way as to foster harmony and group unity. And Best Entrepreneur Award from Dr. N. Lingaraju, Principal of GSPS Homeopathic Medical College, Hyderabad, India. Association, a prestigious organization, honor and awarded her for selfless homeopathic and humanitarian services and Ladies Night Out on 2022 in Deepa. Also, Dr. Kavitha received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Mamata, Senior MLA Mr. Rajenimbalkar, Ex-Director Homeopathy, Government of Uttarakhand and Chairman of Homeopathy and Research Institute during National Homeopathic Seminar, Homeopathy, the Future Medicine at Kashipur on 21st August 2022. Dr. Kavitha was honored as a Woman of the Year 2023 from prestigious organization NATA, North American Telugu Association, USA. Dr. Kavitha was also honored by renowned DTA Executive Committee on Mother's Day at Michigan, USA with DTA Community Service Award 2023. We are extremely happy and proud that we celebrated 12 years of our work beyond the limits, a challenge to oneself. And in January 2022, we launched an ebook, A Dose of Spirituality with Kavitha, in presence of honorable guest of speakers, American Institute of Homeopathy President Dr. Alex Becker and Oxford Homeopathy CNC President Dr. Shweta Singh at our garden. At our second annual celebration, our honorable guest of speaker Dr. Shweta, Chairman of Enlightenment Education, launched audiobook and hard copy of her second writer, A Dose of Spirituality with Kavitha.
At Second International Homeopathy Study Group Conference, Homeopathy and Research Institute proudly honors Lifetime Achievement Award to Dr. Kavitha Kukunoor, President and CEO of Ka Group, for her consistent and outstanding and relentless, selfless service for the homeopathy fraternity globally for past 30 years, and best wishes from Kevin Friendly Foundation and Chief Guest Dr. Shreepad Hegde sir and Homeopathy 360. And I am very honored and privileged to be part of this group. She is so humble and supportive. I never saw her losing her control of her patience and emotion. So she is the inspiration for all of us. So as a gratitude, I and Dr. Deepa want to give Deepa Rajenimbalkar want to give her a small gift. Thank you so much, Dr. Mamata.
Dr. Manisha is there. Dr. Manisha Chopra. You, on my behalf, you can call her. Mamta, Dr. Manisha Chopra is there.
She is there.
On my Dr. Manisha, please come on my behalf. I am not in person. Please come.
Yes.
Yes, doctor. Yeah. Glad to see you.
Thank you.
Thank you, Dr. Deepa. On your behalf, I'm just meeting her for first time, but I'm really happy because she's always smiling throughout since morning. I'm seeing her. Her smile is always there on me. I have met a very amazing personality today. Thank you,
Yes,
Dr.
yes.
And now I want to, hello? Now I want to read Dr. Manish Jain, Director of PJ Publishers and Homeopathy 360 team, and given his views about the Ka group that and Dr. Kavitha ma'am, that success is not a genetic and inherited factor. It is a masterful achievement that develops through the understanding the risk and perseverance and dedication and the never quit attitude. Dr. Kavitha is a perfect example of this, and good fortune does not happen because of the luck. Her hard work, efforts, and dedication and commitment clearly demonstrate the extra mile she has traveled to achieve the position at which she is today. She is a source of inspiration for all of the people around because her passionate commitment towards the homeopathic fraternity. It has been a great experience to collaborate with Ka Homeopathy Study Group for the grand webinar series from 25th October 2020 to 3rd November 2020. My whole team of Homeopathy 360 wishes her the best of luck for every venture she undertakes in the coming future. I personally would like to thank her and her whole team as well as wish her a grand success for each member of Ka Homeopathy Study Group.
Thank you so much, Manish Jain, for a nice review, and we will continue to work with you. And I have here my dearest friend Nina's cousin, Sudha. She has accompanied me, and thank you so much, Sudha, for coming.
Really a privilege to have a very good friend like Kavitha. I'm really happy and I have gained much more knowledge on homeopathy. Really, it's very pleasure for me. Thank you very much for that.
Thank you all, and everyone was so super hungry. It is past 2:30. I appreciate everyone for your patience and waiting for long, and wishing everyone good luck. And thanking once again, I thank my family, my Homeopathy Study Group, dear friends, everyone for coming over here, and Dr. Shreepad Hegde for making our event more happy and colorful, memorable, and everyone for coming here. And this will be like a memory. Thank you all. And we are ending, signing off, and with much gratitude.
Thank you.
Thank you.
Thank you, ma'am.
Yeah, anyone wants to speak just a few words before we end?
Dear Dr. Kavitha madam, hearty congratulations on receiving the award. Yes, you lots and lots, you deserve it. Many congratulations. Thanks a lot to Dr. Shreepad Hegde sir for his all guidance.
Yeah. And everyone wishes they will receive the Lifetime Achievement Award soon. Thank you all. Yeah, she can. We are ending. Dr. Shweta, shall we end?
Sure, ma'am.
Thank
Dr.
you.
Deepika, your award is with me, and I'll send you that soon.
Thank you all. Okay, we are ending.
Congratulations, ma'am.
Yeah. Dr. Shweta, you can end the video if you have that ending video.
Sure, ma'am.
Yeah, thank you.